I think we're ready to roll here. So we'll convene the Dubuque County Board of Supervisors meetings Monday, December 21st, 2020, 10 a.m. From the Courthouse, 4th floor, Board of Supervisors chambers, and via Zoom. And so we'll go right to the agenda. And the first part of our agenda is the work session to discuss COVID-related issues. And with that, we'll go to Patrice Lambert, our Director of the Dubuque County Health Department.
Good morning, everyone. I hope everyone is doing well today. We are just going to start, Samantha and I see Samantha just posted our website, or I'm sorry, our PowerPoint information, but I'm just going to, again, give a quick highlight of our COVID-19 in Iowa dashboard numbers that we have as of this morning. In Dubuque County, excuse me, we have had 46,840 individuals tested. Out of that number, we've had 10,234 individuals that have tested positive. Out of that number, we've had 8,743 of those individuals that have recovered. And unfortunately, Dubuque County has had 133 deaths. Again, one of our key components for our metrics that we, the incident management team does keep our eye on are the hospitalizations. And as you have probably heard, our hospitalizations have been decreasing, which is good for us. As of Saturday on the COVID-19 dashboard, it has listed 24 residents of Dubuque County were hospitalized somewhere in the state of Iowa. Unfortunately, we do have 5 of our long-term care facilities that have deemed the status of an outbreak status, those being Shady Rest Care Center in Cascade, Hawkeye Care Center in Dubuque, Stonehill Care Center in Dubuque, Manor Care Health Services of Dubuque, and Bethany Home has been added to the list. We still always look at our positivity past 14-day average by county, and Dubuque County has decreased to 10.4%. Now, we do know that the schools will be on, for the higher ed as well as the pre-K through 12, will be on holiday break, but we will continue to keep our eyes still on that positivity rate. So with that, Sam has posted our PowerPoint, and our first slide is showing the White House report. You can see that indeed we are increasing, but we still are not out of the red zone. Dubuque County, as well as the city of Dubuque, are still deemed in the red zone with the White House report. Next slide, Sam. We know in that White House report, it did indicate that the virus levels are decreasing in Iowa, but are still at high levels. Throughout the holiday season, all media platforms should remain saturated with messages on the risks of indoor social gatherings without masks. Keep all mitigation efforts in place. Find ways to keep testing levels high through the holiday season to remove asymptomatic transmission over the next 4 weeks. And we do continue to do our campaigning with our virtual holiday celebration. We do stress, again, for these next 2 holidays, please only celebrate face-to-face with those individuals that live in your own same household, and then do the creative virtual, whether it be through a conversation over your dinner table or watching each other open up their gifts virtually. We cannot stress that enough. We know that the citizens did indeed listen to these mitigation strategies, we believe, over Thanksgiving, because we did not get a surge that we were anticipating. And we truly, truly hope that that stays hold for the next 2 holiday seasons. But again, Sam did list our test clinics sites at Epic Health, as well as the Grand River Medical Group for our Test Iowa sites. They will be open Monday, Tuesday, and Wednesday, but closed on Thursday and Friday. And then again, both locations will resume their normal hours next week, except they will be closed only on New Year's Day. And we cannot encourage people, again, if they do want to be tested, to go to the sites of the Harding Drug or the Hy-Vee sites. Again, we feel very, very fortunate that we do have these testing opportunities available for Dubuque County. Next slide, Sam. This is our zip code data. We will be reporting this every other week. We did talk with discuss this with our Board of Health on Wednesday evening, and we just feel that people are on information overload, as well as many of our smaller towns were seeing less than 5 cases being identified in that previous week. So we just don't want people to think that, oh, because they didn't have any cases, it was less than 5. We don't want to give a false hope, because we do need to follow the Iowa Department of Public Health criteria that if there have been less than 5 cases, we cannot list it. So even if a town has had an indicator for the last 2 or 3 weeks that they've had less than 5, that less than 5 could be 4 new cases. It could be anywhere from 0 to net 4. So we just feel it would be better data if we did do this on an every other week status. But Sam did list the comparison from last week, December 14th, which is our orange bar, compared to this morning's data. And you'll be able to see that our total cases, our total recoveries, and our total deaths all increased. Our active cases, though, did decrease. And I'm sure if anyone has read any of the media stories, or Randy Gale, our PIO, does our Incident Management Team daily update, that our numbers have been on a decline this past week. So the next slide, Sam. And this is another barcode of our zip code data. And Sam, I'm going to let you explain how these numbers might be a little bit different on this one compared to our deaths that are now being coded a different way.
Sure. So at least right now in Domo, we can see the total number of deaths in the county, but it's not letting me see them down in a zip code specific way. So usually when I calculate the active cases, I'm taking our total cases in that zip code minus the recoveries plus the deaths. But today I could not include the deaths in that. So these numbers are slightly different, but it shouldn't make huge significant changes in the numbers.
And we know that they are doing some adjustment with our Domo, so we'll be able to see if this is going to be a permanent change, or in 2 weeks when we do get this data out again, we can see if that is going to stay. And Sam did place a star, which I thought was very good, at all of those zip code towns that have seen an increase in the active cases over the past week. And again, it's really no surprise our numbers have been down, that we did not have that many that many towns in our county that did have a significant increase. Our smaller ones, such as Nubiana and Rickardsville, Durango, and Grathville, did indeed. So we'll keep our eye on those numbers for sure. Next slide, Sam. And this is just another barcode of our total cases of the zip code that we have as of today. And this is just another barcode that you can see the percent of the positive cases per zip code based on the population size. And basically, those have pretty much stayed as presented here for the last few weeks. Okay, and then just a little bit of an update on our vaccine update information that we have. Originally, the state of Iowa was expecting the allocations that are presented on the left side of this slide. During our Board of Health meeting last Wednesday evening, we actually received a health alert that the allocations of our vaccines for certain states, such as Iowa, would be reduced. So those new estimates are presented on the right side of the slide. When we look at the week of last week, 12, 13, 20, really we had no effect with those changes at all for Dubuque County. We did receive our Pfizer vaccine as was planned, and those are now in the hands of our hospitals for our healthcare providers, and those vaccine injections are occurring as they have since we received that vaccine on Thursday. Now this week, we are expecting our shipment of our Moderna vaccine. And if you look at what was predicted last week, it showed that the state of Iowa should have gotten 54,000 doses. The decrease that we will have in the state of Iowa is only going to be impacted by 200 doses. So we don't know if that will affect, if that decrease of 200 will affect Dubuque County's allocated vaccines that should be coming anytime after today or after of our 400 that we have been planning on receiving. And those 400 doses will be going to our medical associates, Crescent, as well as Grand River Medical. And again, those vaccines are to be used for the healthcare individuals. Now, we should be finding out today, and I see a health alert did just come up on my screen, so I don't know if this is pertaining to the vaccine or not, but we should be hearing if Dubuque County will be receiving additional doses of Pfizer today. If you look at the chart on the left-hand side, the state of Iowa should have been receiving an additional 31,000 doses of Pfizer today. And if you look on the right-hand side, that is quite the decrease. Now, the state of Iowa is only expecting 19,500. So we don't know in Dubuque County as of yet if we will be receiving any of those Pfizer vaccine doses this week or not. Iowa Department of Public Health did inform us that basically from here on out, our Mondays will be our receiving day of our emails or our notifications of what vaccine we should be expecting and what the doses should be. Then the incident management team will be meeting right after those notifications to determine the distribution of those vaccines. As you know, we do have to follow the CDC as well as the Iowa Department of Public Health guidelines of what our priority groups are. And right now we are still in the priority group phase of 1A. Once we get all of our healthcare workers completed, which is the vaccine that the incident management team receives, then we will be able to start looking at 1B eligibility. We also know that 1A, our long-term care facilities, are included in that. And fortunately, all of our long-term care facilities have contracted with a pharmaceutical company. So that pharmaceutical company will take care of all of our long-term care staff and residents for those vaccinations. So again, we are anticipating our Mondays will be full of communication from Iowa Department of Public Health to the incident management team on the vaccination, and then the incident management team will communicate with those eligible groups for that distribution of the vaccine. The next slide, Sam. Again, with Dubuque County, we are, again, very, very fortunate. We have agreements from 55 healthcare providers, and that's basically for 20 sites. Or I'm sorry, that should be switched around. We have 20 agreements that will cover basically 55 locations. And that would be like all of our satellite clinics that we have throughout the county that are affiliated with our hospitals. Our pharmacy agreements, we have 8 that would include 53 sites throughout the county of Dubuque. Our priority group of our 1A for our healthcare workers, we have 4,857 individuals identified in Dubuque County as meeting that criteria. And as I had mentioned, our phase 1A priority are our hospitals and our long-term care. Vaccine allotment through the Iowa Department of Public Health to the individual counties are based on population. And we do have a group that is identified at the Iowa Department of Public Health as the Iowa Infectious Disease Advisory Council, the IDAC. And they are the ones that will be giving us guidance. They will actually receive the guidance of those priority groups from the CDC. Then this IDAC group will fine-tune those priority groups for the state of Iowa, and then they will, again, communicate to each of the individual counties of those priority groups for any future vaccines that will be distributed to each county. There is, let's see, I believe Chuck had shared with us, Chuck Eisenhart, yesterday, a letter that we are able to submit priority groups in that IDAC to that Iowa Infectious Disease Advisory Group if we feel that priority groups should be listed or even considered for the next priority group. So Sam did indeed put down the 2 links that are good information if anyone chooses to go to those sites and respond. The next slide, Sam. Again, this is just briefly telling you our priority A group, which I have covered, and currently with our priority 1B through the CDC and the Iowa Department of Public Health, we do know that this can still change. But as of last week, we were informed these were the initial groups that would be looked at for being the priority 1B group, those being the residential care facilities, the assisted living programs, the elder group homes, and the independent living facility for the residents 65 and older. It would also include our emergency and law enforcement personnel, our food packing and distribution workers, our teachers, school staff, child care providers, and then our adults with high-risk medical conditions. Now, we know that this could change by the time we actually get the vaccine that we can start distributing to this priority 1B group. But the incident management team has already started to reach out to these identified groups for 1B, just in preparation that if indeed this were to remain as is, that we would fine-tune our Dubuque County workbook plan that would include these groups. So the next slide, Sam. And then Sam always lists the updated links that are just good information for everyone in Dubuque County. So with that, I am open to any questions. I know Stacy is on as well. If you would like Stacy to give her update and then ask us questions, I'm open to anything. Thank you.
Thank you, Patrice. Any questions for Patrice Lambert?
No.
None for me.
Okay, thank you. Okay, we'll go to Stacy Killian for her report.
Good morning, everybody.
Good morning,
So
Stacy.
I just have a few updated numbers to give you for this week. as Patrice mentioned, the cases have continued to decline, which is wonderful. In the last week, we had 244 cases that we did follow up for contact tracing this week, and that was down from the previous week at 344 cases. So you can see a pretty significant decline. We're continuing to follow up with all the long-term care facilities and then also other facilities that have reached out and asked for daily public health support. We are now following and doing daily follow-up checks on 15 different facilities, and that includes our long-term care, some assisted living centers, some of our colleges, and then other facilities that have reached out. Total calls from our public health call center is 31,187. This is an increase of 512 from the previous week, which in looking at the week before, it was 379. So quite a significant uptake. I attribute a lot of those calls have been vaccine related. We've gotten calls from the community, businesses, healthcare providers, and so we've been trying to field and answer those as best we can. We are going to continue with our contact tracing in partnership with Iowa Department of Public Health. It's working out well. We are doing the plasma donation calls. In total, so far, we've reached out to 542 people, which I think is a significant number. Most of those calls are positive, and we hope that most people will follow through with donating the plasma. And right now, we're currently prepping for potentially starting some vaccine clinics as we look at opening up more priorities as more vaccine comes in. We know VNA will provide a gap filling service. Obviously, we want to make sure that the vaccine gets to the healthcare providers, but VNA will step in, assist, and provide COVID vaccine clinics as needed, depending on what the priorities are and the vaccine availability. But we are preparing our staff and our schedules, knowing that that will be coming soon. So that's kind of where a lot of our focus is right now. And I think that is all of the updates that I have, unless I missed anything, Patrice.
No, I do see that there is a question from Chuck. Where do the religious communities fit in the vaccine priorities? They are long-term care facilities. The religious communities are not affiliated with the national pharmaceutical companies, to my knowledge. We have not received that notification if that was changed. We will be submitting a request to the IDAC committee to indeed see if our religious communities can be fit higher up in our vaccine priorities. But for the state of Iowa, right now they are not listed as in that priority group of 1A. But no, Stacy, I think you covered all from the incident management team as well. Thank you.
Thank you, Stacy and Patrice. Any questions for Stacy Killian?
No.
None for me.
Okay, thank you. All right, we will move forward on the agenda. We have next up our Sunnycrest Manor and interim administrator update from Tammy Freiberger.
Good morning, supervisors. Today, we have our testing this week is on an alternate schedule because of the holidays. We did test residents yesterday, and we had 0 positive residents. So we remain free of COVID there. We did have 1 positive staff person this morning that we sent out PCR to get confirmation on that positive, but we anticipate it to be positive. But kind of like the community numbers that we're hearing, Sunnycrest has seen a reduction in number of positive staff during the week. We're having about 1 positive staff person per week. Currently in our level 1 monitoring area, such as a post-hospitalization, we have 0. Our level 2 symptomatic area, we have 0. And our level 3 COVID area, we have 0. We still continually, we're actively awaiting all of our information on vaccinations. I've been in contact with my Walgreens contact individual, Carla, and I had asked her a few questions. And for now, The vaccination continues to remain Pfizer, despite I had mentioned to her, that we had seen on the news the decreased amount of distribution. And to her knowledge thus far, the vaccination that we would be receiving would be Pfizer. I am to get more information this week, be reaching out to us about vaccination dates and further planning. We've actively been working on our consents and facility staff education through a multitude of different ways, through writing, through talking, through PowerPoints. And I also did ask, but have not received an answer about the question with regard to would there be any facility costs, particularly for those individuals who maybe don't have insurance. I think that they would probably be able to bill insurance, for the administration fee. I know the vaccinations will be free. So I will report that answer as soon as I have that answer from my Walgreens contact individual. And I think that's all I have.
Okay, thanks, Tammy. Do we have any questions for Tammy Freiberger?
I do not, Tammy. Happy holidays. Thank you.
Yes, you're welcome. Back at you.
I do want to point out for those that are in the meeting that we do have a Sunnycrest Manor work session at 1 p.m. And it's not necessarily to talk about COVID. There's lots of things going on at Sunnycrest, lots of good things going on there. And I think a chance to talk about our great facility at Sunnycrest. And so Tammy, we'll see you at 1 o'clock.
Absolutely.
All right, thank you. Okay, we have next up then will be Tom Berger, Director of our Emergency Management Team, for his update.
Morning, supervisors. The only thing I have to report is we're going down to Cedar Rapids to the node today to pick up a large supply of gowns, gloves, and masks that are part of the distribution that the governor announced the last couple of weeks that are going direct to long-term care facilities. So hopefully we'll get them back today and get them sorted and then delivered tomorrow, but it'll be quite a bit of PPE going direct to the long-term care facilities in the county. So that's ongoing. And then the updated numbers as far as the masks that we have available for the public, we still have 19,500 of the individually wrapped masks and about 21,000 of the bulk masks that the Board of Health had purchased. And then we still have around 13,000 of the Board of Supervisors, those initial masks as well. And that includes some that were, we did get some donations of just regular standard procedure masks that are included there. So that is what I have at this point. Any questions?
Thank you, Tom.
Any questions for Tom Berger?
None.
None for me.
I have a comment, Tom. I during this whole pandemic, I want to just thank you. You've been a steady leader through this, and calm. And I was thinking about that, and we have a person in charge of our emergency management services that charges into burning buildings, has assisted people out on the road in accidents, and sometimes, and he's seen all kinds of things. So I want you to know that it hasn't gone unnoticed how steady you have been, and I want you to know how much I appreciate that.
I appreciate that, Dave. Thank you.
Thanks. Okay, next up, we have a testing update. I don't know if we have anything additional. We tend to cover this during the reports. If anybody has anything, sometimes I mention Ed Raber here, but I don't know if we have any additional updates. I think it's You know, I do want to give credit to our team, including Supervisors McDonough and Wickham. I think we all pushed for, as a team, pushed for testing. I think we were successful in getting to at least a decent place in regard to testing. Was not the case earlier in the pandemic, but that, you know, we pushed to change that, and I think had little something to do with that. And then our team, our Patrice and the incident management team was helpful with that as well. But I think that was a success in that citizens of Dubuque County can get tested relatively easily. So I guess I gave the testing update. So, all right. Next up, we have our chair of the Dubuque County Board of Health, Tom Beschen. So Tom, I'm going to turn it over to you.
Thank you, Chair Baker. I'll give a brief update. The Board of Health did meet last Wednesday night, and among the business that we covered, a quite lengthy COVID-19 update, which you've heard most of that from Patrice, as well as further updates. We did manage to get through our section of the budget ahead of the requirement of having it to the supervisors in January. There are some things I'm sure we'll have to have a work session to discuss as this goes through the final stages. But the Board of Health did approve that budget, and it's now coming to you. We did have a well variance in the Massey Station area. Colin Dolphin led that effort, and upon recommendation from the Iowa DNR, the Board of Health did approve a variance for the location of the well. I have one other thing I want to discuss, but before that, we will meet again on the 6th of January. Our next rotation in meetings would have been the 28th, or excuse me, the 30th of December. So we forewent that night and moved it to the 6th of January. But the item that I wanted to discuss with the supervisors today was the reporting. Right now, we've had a long series of reporting efforts to the Board of Supervisors by the incident management team and by the Board of Health. We've developed an excellent communication process. Well over 80% of what Patrice shared this morning is going to be published in daily reports that come out from Randy Gale and from other sources, as well as being reported in the TH on a daily basis. The board feels that it's time that we need to talk about how often we're providing an update to the Board of Supervisors. The weekly update seems to be redundant with everything else that's coming out. And we would like to suggest that the update from the incident management team be made at the Board of Health meeting. You know, just looking at your agenda today, you have a lot of business to cover without a 45-minute update on what's being published in the paper. So I guess I'd open that for discussion, and I'd ask the Board of Health members, Diane, and I see Katie's on here. Any other comments from the two of you before we throw this open to discussion?
Tom, this is Diane, and I support the utilization of Patrice's time and Samantha's time. And actually, technically, they should be reporting these things to the Board of Health before the Board of Supervisors. also, because we are the ones that do employ them. We are the ones that are responsible for them, that they report to us. And I have no problem with inviting the Board of Supervisors, in addition to the public, to our Board of Health meetings. I just feel that at this point, especially when we're asking more and more of the incident management team as a whole and of Patrice, with the distribution of vaccine, that's changing almost on an hourly basis right now, and them having to change gears. And so I just feel that it would be a better utilization of their time and getting the information out to the public, you know, if they are able to focus on that rather than on the report that is already being published and sent out.
Thank you. And I guess that was brought out at Monday night's meeting as well. The schedule that we're looking at, or that the incident management team is looking at now, is that on Monday, they're going to receive notification of the allotment of vaccines. And they need to be recommending back to IDAC or whatever branch of IDPH where those vaccines should go. To take an hour, hour and a half out of their time on Monday morning is really going to put them in a crunch to get that done. So again, I'd ask the supervisors to consider, you know, it's always nice to hear, but I think the information is being communicated efficiently and effectively without this step in the process.
Tom, Dave Baker, I didn't want to jump in until the Board of Health members were done. Is it appropriate?
Yes, as far as I can see, it's appropriate, David.
I'd like to just comment on, for me personally, and being the chair of the board. If you recall, we met twice a week. You know, this thing hit us all, and you know, it hit us like a ton of bricks. And you know, we didn't have a manual for this. At least, you know, we were kind of winging it, doing the best we could with it. And so I think having that input from our experts was invaluable during this, especially during the initial stages. I think it was necessary. I guess I think maybe I'll let Supervisors Wickham and McDonough comment on where they, you know, where they want to be going forward. But I have appreciated, and I think it made the decision making for funding Board of Health matters. I think we had a you know, a better handle on it because it didn't just come out of the blue. We could see things coming. We got great reports from Patrice and Stacy and Tom Berger. So I don't think we did the wrong thing. I hope you're asking us to review now that it seems to be shifting into the vaccine phase. And that's something I think maybe the board can look at. But for me, I think having an informed Board of Supervisors that is responsible for providing the funding and allocating the funds that were needed was absolutely necessary. So also, you know, we couldn't have asked more from our Board of Health, and you and Diane and all the Board of Health members have done a wonderful job. And I have a great deal of respect for each and every one of you. And I think that we'll be able, you know, the board will be in good hands going forward. And I think they'll be able to work out something that's, you know, beneficial for the Board of Health and for the Board of Supervisors. So I'll open it up to Ann or Jay.
Well, I appreciate your comments very much and your issues. First of all, Patrice does not need to give the same 18-minute slide presentation to every place she goes. She does not need to do that, and I would be interested in having that be much more succinct in an update form. I would share for general population that Dubuque County is an outlier in the way that the Board of Supervisors and the Board of Health interact with each other. Becky Nowacek and I have had conversations about that. So the way forward, I would agree that there's a need to have greater communication, not necessarily in this format, but that I think this has shown that the supervisors need to have greater connection to the Board of Health. When I attend your Board of Health meetings, I am relegated to the gallery. You have no chat function, and my comments are simply those of the community members at the end of your meeting when you've conducted your business. So how to have communication with you is something that we will need to work on. I think we've seen gaps in community structures. I think we've seen things that need to be improved, and that's not done yet. That's ongoing. We are still obviously engaged in very much, certainly my first pandemic. So I value your input, and you raise an interesting point about how do people choose to spend their time. And, you know, that's something for internal reflection for everybody. But, you know, it'll be a new board in January. And I think that I certainly intend to raise the question and the issue of how we engage and communicate with you. We either need to have a member of the Board of Supervisors on your Board of Health, or we need to have a liaison functioning in some kind of capacity. So there's other things to discuss, but you know, it's not something that I'm interested in making a final decision about today. I think what we need to do is have greater communication, not necessarily greater presentations.
Supervisor Wickham?
Yeah, I think there's, you know, I think it makes sense to, you know, ask the question, hey, is our communication channels often enough, and is it the right information? You know, and so that's maybe not the best setting to do that in, you know, 40 or 50 people, why we talk about when and where we want to communicate. But in short, two things I see are changing, and so might not be the time to make rapid changes related to the cadence that we have. One, a new board that Supervisor McDonough referenced, and then two, we're entering now the vaccination efforts, and those are all new and unknown. And so that's information that the public's asking me about, and I need to be educated on that, and that might take a little more face-to-face time. But I would be okay if we changed the presentation that the health director provided. And so me personally, I don't need information that's already out there. I'm very attuned to going to the IDPH website. I'm very attuned to seeing all the emails that you mentioned from Randy Gale. It's published in the TH. I read it every day. And so all of the numbers and metrics, that is good public information. And I think we did a tremendous job getting that information to the public. But I personally don't need Patrice probably to go over that in depth. But we have a new board member coming in January. So my final word would be, I think it's a great conversation. Let's address it in January and see what changes that the new board wants to decide.
Okay.
Supervisor Wilson, I guess I'd have one comment back to the Board of Supervisors, and that's as we move forward, I support better communication. What I'm having a problem with at this point is what I see as more control. This Board of Health was appointed to make decisions, and it appears to me that every decision we try to make, we need to ask permission. And that's not why we were appointed. I think this board needs to have the authority to move forward on some issues, spending money, for example. And those are discussions we can have, but I see that as a part of the entire issue that we're facing right now. And You know, the fact that we've got 5 new board members coming, hopefully coming in January, a new supervisor sitting on the podium here next month. Great, let's have those discussions, and I welcome them. Thanks for letting me bring it to the forefront here.
Dave, this is Diane. May I make a comment?
Of course. Actually, I think we're still in, I think Tom still has the gavel right now. So yeah,
Okay.
you outrank me right now. So.
Okay. To begin with, I thank you for all of your comments regarding this. We do need to improve communication, and it's not just with the Board of Health. I believe that we see a lot of miscommunication through the whole county that needs to be looked at also. And I believe what Tom's just addressing is not whether we need to increase communication or not, and not whether we're willing to work with each of you and with our new board members and with your new board member, but where does the negotiations, or where does the communication allow the Board of Health to also have a voice, rather than us going ahead and making decisions only to find out that those decisions were not agreeable with the Board of Supervisors. And the other thing is, what we really were talking about on Wednesday night was the role of Patrice in the whole county, but also the expenditure of her time in, number one, preparing these presentations. And I realize it definitely can take a different look to it, and the information that you want could be more concise. But that also can be accomplished through direct communication with her. And you still have Ed Raber on that actually, she could be sending that update like Randy sends, and he could communicate to the 3 of you, since you cannot be individual, you can't be together other than through the Board of Supervisors meetings because of quorum. But, that is my input on this. Is we're looking at Patrice, and we know what her schedule's like. We know that at 1 o'clock in the morning, 2 o'clock in the morning, she's still working on these things. And again, at 5 o'clock in the morning. And, and she's doing a lot of that on her own time, which is county time also, because she is doing it for all of us. So that is the reason why we were looking at her update being something other than more utilization of her time, because no matter what she presents, it's going to take time to present it.
Okay, thank you, Diane. All right, Tom, anything else?
No,
Board of Health?
nothing else, Chair Baker. I wanted to open those discussions, and I look forward to further discussions after the first of the year. I think we all need to understand each other better.
And I will like to comment. I think Diane made a really good point. We have Ed Raber on board, and I think Ed can help, and he does provide us with updates, and he is out there turning over stones and opening up communication. So that's a consideration, and I'm glad that Diane pointed it out, that we do have Ed Raber in the position as the county executive to help with communication. And we did not have that at the beginning of this pandemic. So that was a good point raised by Diane. Thank you, Diane.
Thank you.
All right, thanks, Tom.
Thank you, Dave.
Okay, we'll move forward. We have updates from Dubuque County municipalities. Does anyone have any updates? Or are there any Dubuque County elected officials, municipal elected officials from Dubuque County that would like to speak? And again, I'll comment, I know Ed Raber gave us just recently an update on conversations with many of our small towns and mayors and city administrators. So, okay, we'll move to vaccination update. I think we got a good dose of that, pardon the pun. But does anybody have anything else to add on vaccinations?
I'll add a personal note. My son was vaccinated as a physician at Medical Associates, and I found when he informed us of that, it was incredibly emotional as a parent to realize that you've got someone, we have other family members still waiting for the vaccines also in frontline positions, but it's a great day, and everyone who's worked so hard to get us to this point, you have my extraordinary gratitude.
Okay, thank you, Ann. That's I'm glad that Dr. Healy got vaccinated. And
one of the things that would,
go ahead, Jay.
That would help me related to vaccinations. So the categorization of the groups that Patrice shared in her presentation are good. I'm kind of a numbers guy. I would like to see the estimated number of each one of those groups. And ultimately, what I'm very interested in as we try to set public policy and various budgeting items for health departments and the components of COVID-19 relief that we're providing is when will we project, if we can, we'll get to those milestones. So if we have, Dubuque County math is easy, if we have 100,000 people in our community, if unfortunately we already have had over 10,000 that have already tested positive, that leaves 90,000. If you're trying to get 50% of those vaccinated, that's 45,000. When do we think that will occur? And I know we might be a long ways from it, and I've talked to Patrice a little bit about this a few weeks ago. Is there any projection? Is there any model that gives us that indication? Because events are being planned for the summer. And if we are basically at the same place, maybe 20 or 30% overall, either carrying the antibodies as far as the immunity, being positive or being, vaccinated, that might not be enough. And so that's kind of what I'm trying to get at. So if anyone else shares that, or if there's any other information that we can try to figure out to guide decision makings in the summer and the fall, that would be very helpful.
I share that concern, Supervisor Wickham, and I think we should begin to address that. And I think that is a perfect thing for Ed to help us with, like he did, pushing the envelope for testing. That's exactly the kind of thing I think he could get our questions answered with regard to that. I don't know if you have another proposed venue for that. I don't, in light of what we just discovered, I'm not sure we want to add anything more to Patrice's day, but Ed would be the guy that's got the connections probably to start looking at those numbers. Do you have another thought, Supervisor Wickham?
My other thought might be back on communication. The area that I see is kind of a void is the incident management team. And so I kind of not sure how often they meet and or the information they have. And, maybe there is no additional information or thought process going on, but that's kind of an area that I think, I always just question about how much information and how much planning is going on related to that team that we might be able to add value to, or at least understand. But it's more of a question than a statement of what we're going to do.
Well, we might look at maybe even at changing the agenda even for our meeting next week to begin the process of, I certainly don't think we don't need, we can start striking some of these standing 6 items and instead ask for, an update with some critical points that we want to address. I don't think we need a testing update if that's going to be covered in some other format, but I think our professional folks probably, in light of this discussion, see that there's maybe we need a director of health report, but we also need to have an administrator report or something to start. I think I like your ideas about getting those numbers and those projections. good points.
Thank you. And I agreed. I think looking at in January, looking at revising this schedule of 1 through 6 related to the agenda items would be wise. And then asking the Board of Health and or certainly our health professionals director, Patrice Lambert, and others, Tom Berger and, Stacy and even Mary Rose, what should be the components on the agenda, and just trying to get those right, because some could fade away a little bit, and then vaccination obviously is going to be probably front and center pretty quick.
Agree.
Okay, good discussion. Thank you. All right, if there's nothing else, we're going to move then. Well, actually, we got about 3 minutes before we can start our next work session. So
I will make a motion to recess to 11:05, please.
all right,
Second.
take a
Second.
brief
Second.
recess till 11:05 a.m. and then we'll start our next work session. Is there a second?
A second, yes.
Okay, all in favor signify by saying aye.
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 Aye. Carried 3-0. We're in recess till 11:05. Thank you.
Hey, Anthony, I'm just checking in to make sure you can hear me.
We can hear you, Bob. This is Ed.
Yep, got you, Bob.
Great, thank you.
Okay, our brief recess has ended. We'll reconvene. And it is time for our work session with County Engineer Anthony Bargett. And our first item under the County Engineer work session is discussion with the City of Dubuque Assistant Engineer Bob Schiesel regarding Southwest Arterial 28E agreement. And we have an accompanying resolution. So with that, I'll turn it over to Anthony.
Okay, good morning. I guess at this point, I'll respectfully turn it over to Bob Schiesel to give an update on this agreement.
Okay, Bob, go ahead.
All right, good morning, everybody. This is Bob Schiesel.
Morning, Bob.
Dubuque. So following the work session that we had last Monday and the good comments that were all shared, the city went back and modified the amendment document. And the only thing that we changed or updated was we added an additional sentence to the amendment document under the right-of-way property acquisition clarification section. And that would be under paragraph 3, where we added a sentence to say the city agrees to keep the county informed of the development of the parcels. So that is really the only change that we made. And so we made those changes and resubmitted that, both the resolution and the form of the amendment document to the board for further consideration.
Is that the language in front of us? I think it's a little further up.
No, it's there. It's the city agree. It's there. It's the final in paragraph 3. It's the final line, and I had suggested that something very similar to that, maybe even those exact words, that we would ask to be kept informed. So I think it reflects where I am, certainly. I think Supervisor Wickham, it's kind of up to what your thoughts are about that language. I think it addresses the intent of the county having been a more silent partner, other than obviously providing the 50% match with the city to the matches, but we have been much less involved in this process over the many years.
I think the language is pretty soft and doesn't really commit the city to much of anything. My bigger question, Bob and Anthony, why do we need to amend this agreement? What larger level, what's driving this? Why do we have to amend this agreement?
Well, we thought, based on our previous conversations and discussions regarding the updated final project cost for the Southwest Arterial, that the city was requesting that we amend our original 2080 to add the $320,000 to the original 28E agreement. So, we felt that this was probably the more, appropriate, avenue to get that additional funding added to the county's portion or share or commitment. So really, the 2080 agreement amendment number 2 really just talks about the additional funding in the additional $320,000. But based on our previous discussions, we felt that it would be good to be totally transparent and just kind of provide that further clarification regarding the property acquisition and how it took place and how it was funded and how it was acquired. And what would be
is the property acquisition new language? Is that new language in this amendment, or was it always there?
The section 7 of the document, the clarification, that is new language that has been added. Just again to provide that further clarification, for the
clarification. But so if it was removed, if we remove all section 7, why does the city want section 7? Why do you want all these acquisition language in here? What's the value of it to you?
There really is no value to us other than we thought it was a good fit.
So let's remove it.
To provide that clarification.
What if we removed it? If it has no value to the city, let's remove it. I mean, it's a point of contention between us two, at least for me.
The city would not have an objection to removing that section 7 if the board didn't want to see that in there.
Do we feel?
Can we bring up more of section 7, please?
Supervisor Wickham, do you feel we need some written clarification? If we don't feel we need written clarification and the city doesn't have a driving purpose to have it be there, then it isn't necessary.
I guess I was the one that recommended that we put that in there because at the February work session, there was quite an extensive discussion regarding the property acquisition. So we just felt, again, and to be fully transparent, to put it out there and just so that everybody understood kind of the mechanism, so to speak, that went behind or that were involved and that would be involved with the property acquisition.
Yeah, and I
it was really,
I would be looking to have our county attorney to help us figure out and to protect the interests of Dubuque County. 3 supervisors going over the language is, you know, versus all of your city attorneys is probably not a fair fight. And so I don't know if CJ May and his group has gone over this and has discussed what the value of the land and the acquisition and the transfer of those would be. You know, we're partners. We shared equally in this cost. That's what you're telling me. Now, granted, you've provided more in-kind engineering, project management, and I don't want to minimize that. And the project's been extremely successful. So those are all really good things. The county has also done that in other projects, and the city has, you know, had value, and the 911 system is one I point to. So that's what partners do. And so I guess I would be interested in having the county attorney review this section and see how it protects the Dubuque County's interests.
I have no
And
problem.
maybe the other thing is, you know, why does it, yeah, and then we are coming up on a new board, you know, we'll have another board member, and to, you know, make these decisions that, you know, related to land, related to development, ownership between city and county are important. And, you know, possibly this is an agreement that should be reviewed in January. Decided on in January, excuse me.
Well, this is Supervisor Baker. I think one of the things this is the agreement itself was made in 2013. That would have been a previous board, Supervisors Klein, Demmer, and Eric Mandernack would have made that agreement. And, you know, I think I agree with them entering into this agreement. We have a historic new arterial that'll serve the citizens of Dubuque County well for the next 100 years or more. And so to me, it sounds like the issue is not the funding, which we clearly agreed to in 2013. And I will continue to support the previous boards entering into that agreement and continuing with that agreement, including this board. We've done additions. I don't know if they were in the form of an amendment to the agreement, but we have approved funding. I think even since Supervisor McDonough's come on the board, we've addressed this issue. When the funding has been requested, we have agreed and move forward with it. So if I'm prepared to move forward with it. I have been on the board for 4 years during this project, and in many cases, you've heard me say, I think we need to wait until Supervisor-elect Potoff comes on the board, but he has not been involved in any of this discussions, and I have. So I guess I take a little offense to moving it to January. That sounds like it's trying to get away from me. When I don't, I think I have a pretty good fair streak. And when I have felt it was something with long-term implications, I have said, I think my successor needs to make that decision. But this isn't one of those cases. So I think I'm prepared to move forward. If we're all in agreement to take out Section 7, let's make a motion contingent upon removal of Section 7 if we can do that. Now, if you want to, if we need to have this reviewed by County Attorney May, we have another meeting, we can do that next week. And we can ask him to review this document. And if in the interim Section 7 disappears, I'm okay with that. But I think it's a decision that needs to be made.
Supervisor Baker, I think that, having you have a chance to vote on this would be preferable. But when a colleague wishes to have opportunity for legal counsel to look at it to be sure that their questions are answered, I'm always going to agree with that. And And I also think, you know, it seems as though our meeting is next week, but there are intervening holidays you know, just to be clear, there's not going to be an opportunity, I don't think, for, you know, our county attorney to look at this and also probably confer with city's legal counsel. So at this time, I'll make a motion to table for 30 days to allow opportunity for the county attorney to visit with the city legal team and to bring us back a document that resolves the issues for us, further consideration.
I will second that.
Okay, there is a motion and a second to table this for up to 30 days and have it reviewed by the county attorney. Is there any additional discussion? All in favor signify by saying aye.
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 And oppose, use the sign of nay, and I'll vote nay. But it is carried 2-1. All right. We'll move on. Thank you, Bob Shiesel, for being here today.
No problem. Merry Christmas,
Thanks, Dave.
everybody.
Yeah,
Thank you,
Merry
Bob.
Christmas.
To you too.
Thank you, Bob. Thank you, Gus.
Bye-bye.
Okay, item number 2 on the county engineer's agenda, discussion regarding traffic counts on Christoph Road, Old Davenport Road, and Schuler Heights Road. So Anthony, we'll turn it over to you.
Okay, did everybody have a chance to review the report I submitted for the traffic counts?
I did. Anthony, I have an embarrassing thing to admit. Can you help me find Christoph Road?
Oh yeah, sure. That's it's north of Dyersville. It might be like 6th Street or something in Dyersville, and then it turns into Christoph Road, and that tees up into Floyd Road there.
Okay.
So it's on kind of the northeast side of Dyersville.
Okay, thank you.
Yep. It parallels Highway 136. I'm not sure how far to the west, but not too far west there.
It's a gravel road, is that right?
Yes, it is. Yep.
Okay, thank you.
So between November 16th and November 23rd, we placed traffic counters on Christoph Road, 2 different locations on the south end and north end, and then also at Old Davenport Road and Highway 161 or 61, excuse me, which is actually O'Rourke Lane, comes out and tees into Old Davenport Road. Just on Old Davenport Road there, we placed a counter. And also down there on Old Davenport Road and Schuler Heights Road, just on the north side of Schuler Heights. And then as you turn on Schuler Heights at Old Davenport Road, we placed another counter, and then the final counter on the east end of Schuler Heights Road. So we turned the counters into the DOT for final analysis, and these particular counters were placed 16 feet apart, which allowed us to analyze the different axle types of traffic out there. I was fairly surprised at the increase of traffic actually for all roads within this listing here. As you can see in the table there's fair amount of growth from 2013 all the way up through the new count in November 2020. Christoph Road shows an increase of traffic of about 78.5%, up to 375 vehicles. I think a lot of that was attributed to a fair amount of construction in the Dyersville area with the roundabout and some other construction projects. There are 2 quarries that operate on Christoph Road, and as you can see, 47.8% of the traffic is trucks. So there's a lot of truck traffic that's running up and down that road. Old Davenport Road and Highway 61, big increase from 2017 to November 2020. Went from 970 vehicles a day to 1,571 vehicles. There's a lot of traffic that I think kind of flows out of those residential areas up to the north there. And then obviously some increased truck traffic going on in that area too. So we've seen a 61.9, almost 62% increase of ADT vehicles per day. And also about 11.14% increase in trucks. Then you get down to Schuler Heights Road. The increase in traffic right around there is just on the north side of Schuler Heights on Old Davenport Road, about 102% increase from 370 to 748. And then as you turn east on Schuler Heights, it's about a 16.7% increase from 560 to 654. And then on the far east end there, it's about a 30% increase in traffic with about a 13.46% increase in truck traffic. So overall, on average on Old Davenport Road, we're seeing about a 15% increase in truck traffic. And that is fairly significant. You know, we all kind of knew there was something going on out there for truck traffic. This is a little bit higher than I would have anticipated, or actually would like to see. Typically, we like to see truck traffic percentage around that 5% on your typical county highways. Now, if you have a sundown road type road, you expect a quite a bit higher truck percentage. If you kind of go through the analysis or the report, Old Davenport Road was designed to be or to handle around 8% truck traffic based on the easel design. So we're more than or right around doubling that percentage of trucks, which is going to more than double the easel design and cut down on the life of the road itself. And then, of course, another issue with Old Davenport Road and most of our roads in the county is we don't have a lot of shoulder width. So you get wider trucks out there and you see premature deterioration on the edge of the road. Easel strictly looks at the strength of the road, the strength of the asphalt. It doesn't look at what's happening out on the edge of the road if we have narrow shoulders. So you have kind of two different things going on there with the uptick in truck traffic. Any questions on kind of the analysis part?
Anthony, Dave Baker, not only do we have minimal shoulders on Old Davenport Road, but there's certain spots where if a truck were to go off, it's a long ride and steep drop-offs. It's not made for heavy truck traffic. And I just think, yeah, you know, I know that it wasn't constructed to carry heavy truck traffic, but it's become a shortcut. And I think we need to do something about it for preservation of our roads and for the safety of our citizens who live in that area.
Well, what's interesting too, I ran the length of distance, you know, on Highway 151. If you go up 151 up to 52 and then down, or if you run Old Davenport Road and Schuler Heights Road and meet at the same point on Highway 52, there's only a 1.14 mile difference. Yeah, there might be a little more time at it, you know, due to the stoplights up in the Key West area, but there's not a huge difference in length of detour or length of route. So, yeah, my recommendation is that we would put an axle embargo on Old Davenport Road and Schuler Heights, strictly because we don't have those two roads designed to handle this percentage of truck traffic. And then number two, it's you know, the route around is not that far beyond what they're doing now.
What my friends tell me who live out there, Anthony, is that it's a more than a 10-minute savings in time. So, you know, that it is a shortcut, and that's where Google's taking those drivers. But I would agree. I think your recommendation is something we should be considering.
And that's a fair point. You know, 10 minutes to business is worth something. And that's a point taken. But again, we did not design Old Davenport Road or Schuler Heights Road to handle that type of traffic. You know, we would have had to do a much different type of project on Old Davenport Road with purchasing right away, widening out the roadbed and reconstructing the road to handle that type of traffic. And, you know, we were not prepared to do anything like that with the funding that we had available.
Well, related to the embargoes, you know, Anthony, if I can jump in here, yeah, I get the concept. The embargoes have a lot of issues. So we get a lot of residents, once you create those embargoes, that want to tell us about all the trucks, and then you're bringing in law enforcement. Is there a better way to handle the actual embargoes than we've been doing? Because it seems like it's problematic at best.
I agree. I mean, enforcement obviously plays a key role in that, and enforcement doesn't have a lot of time to deal with this kind of thing. You know, the best thing we can do is try to work with Google Maps, with possibly, I don't know if they can have a way to filter out. I don't know. I'd have to visit with IT on this, if there's a way that they could filter out freight traffic around. We've also spoken to some area truck companies. I'm not going to name names, but we've called one specific company that was running that route quite a bit, and they've adjusted from that. So we have tried to do a little bit of outreach on it. But you know, without some kind of legal requirement out there, they can keep running it all they want.
Yeah, Anthony, Dave Baker, I can tell you from my previous long-term career that, you know, a mile and some change, you know, if somebody's routing trucks and they're going to save a mile, that's now take that times 2 if they're coming back that way. So now we're 2.5 miles. And as Ann said, there might be some time involved, but I also believe that if we embargo those roads, except for local deliveries, that most of the professional drivers will abide by that, and the good companies will not route their drivers through that. They don't want to, you know, they don't want to be violating the law. Right now they're not, so they're taking the shortcut. But you know, it's kind of like chicken and egg, the chicken and the egg. If we don't have the embargo, then Sheriff Kennedy and his staff cannot enforce the vehicles being on that road.
That's
for
correct.
all the reasons we mentioned previously why they shouldn't be on there. So I think most drivers, and if you know we have long haul drivers going through there, they see the sign, they're not going to risk you know, getting pulled over, getting a ticket, going to the pokey, whatever truck driver slang we want to use. They're going to take the 1 mile plus and do the right thing. My opinion.
Yeah, and my recommendation, you know, is more from an engineering perspective. Again, you know, I'm looking at, you know, kind of the design of the road itself, and trying to get the most years out of it as we can. And if we continue at this rate, we are going to deteriorate Old Davenport Road and Sherwood Heights Road very quickly. So we need to do something. You know, we can definitely work on the outreach part and try to do some GPS manipulation. But on the other end, I think enforcement's got to be kind of in the tool bag as well.
I'd like to see us bring Sheriff Kennedy at least into this conversation before. I mean, I am leaning toward the embargo. I think that's what folks would want us to do, to preserve that asset and to do what we can for safety. But I wouldn't want to necessarily go forward unless we bring the sheriff with us. He may not be in agreement with the decision, but he certainly should be consulted. I don't know if you've done that yet, Anthony, or if that's part of the next step as well.
No, that would be the next step. I mean, we would have to have a resolution in place for you guys to consider. And I think before that decision's made, certainly Sheriff Kennedy needs to weigh in on that. We need to decide what part of Old Davenport Road is embargoed, whether it's the entire stretch down to the county line or if it's just down to Sherwood Heights. So there's some things we need to thresh out on this.
This Supervisor Baker, I think this is a case, as I stated previously, this is a long-term decision. So I think having Supervisor Potoff involved in this discussion will be helpful. Also, he'll bring some expertise into this. He was the captain of the road division for the sheriff's department, and he's pulled over his share of wayward trucks, and so I think he'll add to the discussion. So this is one I think most of you know that if I make a decision, I stick with it. This is one I think is a long-term thing that I think our next supervisor should be involved in.
Well, if it's okay, I would like to request another work session, the first meeting in January, to continue this discussion, and I can have a also kind of preliminary resolution put together and with embargo mapping to kind of have something to take off on and have a discussion on.
Anthony, our first board meeting is actually January 4th. I prefer that you looked at the 11th, if you don't mind, unless Supervisor Wickham's got an issue with that. Let's just move it back so that we're not crowding the 4th. Again, we're putting some pressure on folks who might want to take vacation this time of the year with the holiday, unless you think it's necessary for the pattern of our discussion.
No, that makes sense. Let's just go to that meeting date.
Yeah, I'm comfortable with that.
And then
Hey, thank you, Anthony.
Can I ask some questions with regard to Christoph Road?
Yes.
What's the way forward there? What's the long-term look?
Well, that's a good discussion point we need to have during maybe our construction program analysis. There's only a few houses on the road, so there isn't like there's a major residential area that would be served by a new highway there. But there is a lot of truck traffic. There is a lot of vehicles running up and down the road. So it would be one of our highest gravel road traffic counts in the county. So we need to have some further discussion on this. I believe, Bard Construction owns the quarry on the west side and Horsfield owns the one on the east side. I think Bard's lease is going to run out in a couple of years, as I understand it. And so that if it's not renewed or if they're done with that area, that might reduce the traffic a fair amount. Now, Horsfield is picking up activity. They just recently opened that quarry, maybe 5-6 years ago, and they've been working out of there quite a bit. So that traffic is taken off there. Our maintainer operator, we have, I think the best one in the state comes out of that area right there. And he does an exceptional job trying to maintain that road. It is quite the task for him to deal with that road. He has to be out there probably at least once a week, if not more sometimes, just to maintain the road itself. Without purchasing any right of way and trying to design something that will handle the truck traffic, we'd be looking at probably about $1.5 million investment to construct a road there, construct a pavement there.
I'd be interested, just general conversation, and we can have this at another time as well. But, generally it strikes me somewhat similar to what some of the CAFOs generate in Delaware County with timing of the year and heaviness of the trucks that service those enterprises. How do those roads get, do you just assign a maintainer that keeps it the best it can, or is there other kinds of relief that you might be looking at for the, this isn't necessarily the weight on the roads because of an enterprise change, or maybe it is.
Well, that's a great point. These CAFOs generate a lot of extra truck traffic in certain areas. So we usually, I'll give you Delaware County as an example. Each of our territories probably have 5 to 10 miles that get extra rock than the other roads. They would probably get 400 tons per mile in contract rock versus the typical 300 or 350 tons per mile, because that rock's going to deteriorate so much quicker. And those roads are going to be maintained at least on a weekly basis, if not sometimes a little more than that. Your other typical roads that have, say, 50 vehicles a day and no CAFOs on, you're maintaining maybe once every 10 days. But when you stick a CAFO on there, you have to be on top of it probably a minimum every 5 days. So it does change the dynamic there.
So Christoph Road is more similar to that experience.
Oh yeah, definitely. if not more extreme.
Okay.
Anthony, it's not unusual though, and it may not, be it'd be done instantly, but we have two legitimate businesses that generate a lot of traffic, and at some point, the decision or assessment has to be made whether a gravel road, a granular surface, is the appropriate surface. You've got, extra maintenance and extra material, as you said, and then there is the quality of life in that area. If there was minimal traffic count on a gravel road, it needs to stay a gravel road. But I have always in my term and even before that advocated for where it makes sense. We should look at doing hard surface. Now, you're the one that has to figure out the budget and how that priority fits in. But I think maybe this is the start of the process of looking at that road and where we go in the future. Again, not suggesting you squeeze it in to your 5-year plan now, but we should be looking at it, I believe.
Well, and maybe something too, we work with, let's say Bard and Horsfield and whoever else is out there, and maybe there needs to be some buy-in into this project as well. Because you compare this, like say Lewis Road. We paved Lewis Road, but much different characteristic. We're not seeing the truck traffic on Lewis Road that we do on this type of road. So the cost is dramatically higher on this 1.5 miles versus the mile of or whatever it was on Lewis Road. But yeah, this is something we could start talking to Horsfield and Bard and just get some discussion going if there's maybe some in-kind service on this or something.
I'm sure Dennis Steer and Matt Horsfield will be willing to talk to you. So I think wear and tear on their vehicles, I'm sure they would be interested in that as well. So I think that's why we have you as the engineer to sort out these issues, Anthony. And I don't think we can tell you anything except how we feel, and then you tell us whether we're off base or not. So always appreciated that with you. So, all right. Do we have other questions for Anthony on the traffic count report? It was a good discussion. And then we have the next item is the 2020 construction summary report.
Okay, I guess a real kind of basic summary of what we did for construction this year. Kind of more pictures and words here, so it's kind of a show and tell type report here. So in summary, we accomplished 25.58 miles of roads that were resurfaced, and I'm saying contract resurfaced. So we did have our maintenance crews do a few miles beyond that with their own forces. Otherwise, what we actually contracted was 25.58 miles of roads and replaced 12 structures, and totaling about $9.7 million worth of projects. So through these pictures, you can kind of see there's a perspective of the before and after on each of those projects. We had Monastery Road for about 4 miles for $1.3 million. Wapaton Road, 4.3 miles at $1.8 million. No longer the roughest road in the county. Dyersweiss Road, 6.36 miles at about $2.9 million. And then we had the Black Hills and Lansing Road grading and culverts for about $248,000. Then we did the Black Hills and Lansing Road HMA paving project, 2.3 miles for about $739,000. And then we had the Lake Eleanor Road, Old Castle Road, and Ridgeview Lane paving project, which amounted just short of $1 million. That's 3.87 miles. Then we had Riverside Drive, Mills Court, HMA paving, about 1.66 miles for $496,000. And then we had Derby Grange Road bridge replacement. It's a 100-foot by 30-foot concrete slab. The site distance is much better in this new bridge, just short of $400,000. And we had the Hush Road bridge replacement. This is one that we routinely repaired every flood event we had. Replaced it with a 70-foot by 30-foot concrete slab bridge for about $270,000. And then we implemented a railroad flat car bridge on the Holy Family Lane, 66-foot by 20-foot railroad flat car. Contract amount $144,000. And then we had several old deteriorated box culverts or pipes out there. There were 7 of them that we replaced on Fisher Road, Edval Lane, St. Girls Prairie Road, Mitchell Mill Road, and Hilton Road and Streff Road for about $238,000. Then we did some microsurfacing maintenance on Asbury Road and Skyline Road, 3.05 miles, which amounted to about $207,000 there. And that was pretty much it for contract work this year. And gearing up for another very busy season this coming up here. So we'll have plenty to discuss with the construction program presentation coming up soon.
Pete, do we have any questions for Anthony?
Well, more of a statement. I think just fabulous job to you, your engineering, the surveying staff, all the road and bridge operators, and then our private contractors that do a lot of this work. The amount of structures done in my tenure here in the last 5-6 construction seasons is just amazing. We've probably knocked out over 50 different structures during that time, and another 12 that you're doing this year, plus the 25 miles of resurfacing. So really good. You compare that to a lot of the other surrounding counties and or other counties our size. It's a tremendous amount of work. And I understand you guys do almost all of the engineering internally. And that's a great savings to Dubuque County residents, and well done.
Thank you. Appreciate that.
I echo all those thoughts. And I know, Anthony, that you enjoy having a budget that you can actually do some projects with as well. So thank you for your effort.
Thank you. Appreciate that.
Yeah. And Anthony, I will join in as well. A big reason that we're able to get more projects done than in the past is we're not spending near as much money on outside engineering, and you and your staff do a great job. And we do have really good contractors to work with, from the excavating contractors to the paving contractors and everyone else associated with it. So I think we have, with you at the helm, we're in good shape going forward. And much appreciated. This was a great report.
Okay, thank you. I appreciate that.
Thank you. All right, we're going to move forward. All the next items are not time specific. Well, I guess we do have some that are. So the next one is not. We have a public hearing, and this is amendment to Chapter 1, zoning, Dubuque County Code of Ordinances. And I believe we will have our county auditor, Denise Dolan, and Tammy Henry, our zoning administrator. And they have been working diligently on this, and turn it over to them. I don't know if Don Sherman, if you have any comments, or Ed Raber before we go into that.
This is Dawn. Just with this, Tammy's just going to go through before you open the public hearing, if that's okay with you, Chair Baker, to give a summary of the changes that were approved by the Zoning Commission.
Okay, yeah, that's normally how we do it, is we get the staff report and then we go into the public hearing. So let's go ahead and do that.
Okay, good morning, everybody.
Good morning, Tammy.
Hear me there? Okay. So, we went over and went through with the zoning board, and they have unanimously approved the B1, the B2, the M1, the M2, the PC Plan Complex and the airport districts to move them forward to you. Again, you have had in front of you any of the changes that we had done, which is adding all of these headers. We've put those in blue. The green was where we maybe have had something and then we moved it to another section. And the red is an item that was deleted because it was no longer necessary. And again, I'll remind you that this is a process that's been going on for a long time. And so these districts are all ones that haven't had a lot of changes, just a lot of cleanup as well. So if you'd like, Chair Baker, I can start reading the headers in. And then if anybody has any questions, I do know this was published for today. And I know that I believe you've had a chance to review some of it. So I'll go ahead and I'll start reading with the B1 Business District.
Okay, thank you, Tammy.
Sure, sorry. The B1 Business District is intended to accommodate the daily or frequent shopping needs of the neighborhood consumer. Allowed uses include small retail shops, professional office developments, and shopping centers. This district allows residential dwelling units or units located in the principal building where the principal use is a business establishment. It also allows for hospitals, hotels, motels, veterinary clinics, medical and dental clinics, department stores, public buildings, and recreational, religious, and educational facilities. The B1 district does not allow for any outdoor storage, but parking lots for employee and customer parking are required. Special permitted uses in the business district include kennels, pounds, or animal shelters, and custom cabinet, furniture, and woodworking shops not exceeding 6,000 square feet. On-premise and off-premise signs are allowed. So as you can see in the document that's got the color coding, it was really just a few things, a little language, moving some things around. Does anybody have any questions for me on the B1 district?
I do not, Tammy, thank you.
Any questions for Tammy?
All right.
None for me.
Okay, not hearing any, I'll just move on to the B2 district. The B2 Highway Business District. It is intended to accommodate a broad range of retail and commercial services establishments that generate heavy pedestrian and vehicle traffic and have a high demand for parking spaces during business hours, such as including drive-in banks, restaurants, theaters, big box stores, planned retail or professional office developments, shopping centers, and recreational uses such as bowling alleys, skating rinks, miniature golf courses, and places of entertainment. These uses are normally placed along a highway or located in higher traffic areas. No residential use is allowed in this district. All of the B1 uses are allowed in the B2 district except residential. Funeral homes, campgrounds, and vehicles, sales, services, businesses would be also allowed. Outside storage includes larger vehicles as well as cars and trucks that would allow anything on wheels to be stored outside, including RVs, boats, farm implements, and construction vehicles. Special permitted uses in the Highway Business District include custom cabinet, furniture, and woodworking shops not to exceed 6,000 square feet. No manufacturing or warehousing is allowed in this district. On-premise and off-premise signs are allowed. And again, I'll just repeat that there was minor changes here, movement, and just trying to clean things up so that these are more user-friendly when we do get them put into the codification. Does anybody have any questions on the B2? Not hearing any, I'll just keep moving along, okay? M1 Light Industrial District. The M1 Light Industrial District is intended to provide location for a variety of land uses characterized by a production, manufacturing, distribution, or fabrication activities. Allowed uses include automotive body repair, distributors manufacturing and a bottle of non-alcoholic beverages, warehouses, and wholesaling and light manufacturing. This district is not intended for manufacturing uses that create excessive noise, smoke, dust, vibration, or obnoxious odors. All of the B1 and B2 uses are allowed in the M1 district except residential. Outside storage in vehicles and equipment, raw materials, and finished products, special permitted uses in the light industrial district includes a single-family residential unit for custodial purposes if occupied by the owner of a family member on a 3-acre or more custom acres or more. Custom cabinet, furniture, and woodworking shops not to exceed 6,000 square feet. and on-premise and off-premise signs are allowed. So the real change here was, and this one was adding the word light industrial. It was always treated like that, but it really just didn't have it in the header.
So Tammy, in M1, do we have residential capability?
Yes, we do, for custodial purposes. So it has to be at least a 3-acre site, and it has to be for custodial purposes, and that has to go under a special use permit. So if, for example, we approve an M1, it goes through zoning, goes to the board, you approve it, and there is a person who wants to live on that property, that would require a special use permit given permission by the Board of Adjustment for custodial purposes.
And when you say that it's a district, is M1 is it a district? I view that word as meaning it's more than one light, it's more than one light industrial capacity. It's not just one single thing. Is a district, can it just be one enterprise, or is it intended to be multiple businesses? What's a district?
It can be multiple. District can be, it's the clarification of, so you could have an area that has 3 M1s in it. You could have an area that's just 1 M1. If it fits the code and it fits, and the neighbors are not opposed to it and it fits the needs of the area, you could have just 1 M1 in an area.
Thank you.
You're welcome. Any other questions? Okay, then I'm going to move on then. I'm not hearing anything. I'll move on to the M2. The M2 is the heavy industrial district. The M2 heavy industrial district is intended to provide locations for a variety of land uses that by their nature generate higher levels of smoke, dust, noise, and odors that render them incompatible with virtually all other land uses. Allowed uses will generally require some separation from residential and commercial uses and include any non-residential purpose whatsoever, except for those uses listed under the special use permits and structures in this district. Special permitted uses include hospitals, sanatoriums, correctional institutions, gas pumping, metering, and storage facilities, manufacturing of acid fertilizers, gas or glue, dead animal or fat rendering, stockyards or slaughtering of animals, oil refineries and junkyards or auto salvage. It also includes a single-family resident unit for custodial purposes if occupied by the owner of a family member on 3 or more acres on premises. Off-premises signs are allowed. So that's just an expansion of the M2 or of the M1. So it's obviously more heavy manufacturing. Any questions? All right. If I'm not hearing any, I'm going to keep moving on. Then the next one would be this PC planned complex district. And I just want you to know in this district, really, there wasn't anything changed except for the header. All right. And then things were just moved to different locations. The PC planned complex district is intended to encourage flexible and innovative design in the development of 10-acre or larger sites as one integrated project. It would allow residential, commercial, and industrial developments on combinations of these uses that are complementary and integrated, all in the same area. This district requires a site plan drawn to scale showing the location of all streets, lots, buildings with exterior dimensions and designated parking areas, sewer and water facilities, and uses labeled. A written statement must accompany the site plan explaining how the development meets the purpose and intent of the ordinance. It is in accordance with the future land use map, benefits the general public, and meets the general accepted principles of good planning. Any amendments to this plan will be required to follow up all regulations and procedures of the original plan. Any questions? Okay, so I'm going to move into the airport districts. Now I will tell you that the airport districts, before we did anything with these, we sent all of this information to Todd Dulcing at the airport. They reviewed all of these and told us that they didn't feel like anything needed to be changed. So other than we put headers in all of these districts, okay? So the AO Airport Operations District. The AO Airport Operations District is a restricted district for land located on an airport and is established to protect airport operations from any encroachments or land use conflicts. Allowed uses include runways, taxiways, navigational aids, FAA-approved operational aids, and underground utilities. I'm going to go into the AC Airport Commercial District. The AC Airport Commercial District is intended to provide for an on-airport land uses, which are not involved in direct flight operations, but are related to airport support activities. These uses include terminals, fixed base operations, hangars, maintenance, or storage buildings. Also, light commercial industrial uses would be allowed, which would include hotels, retail or commercial office developments, restaurants, post-secondary schools, and light manufacturing uses that do not create a nuisance or a safety hazard for normal airport operations. Then we have AA Airport Influence Area Agricultural District. The AA Airport Influence Area Agricultural District is intended to protect airport operations by limiting off-airport property from development and only allows agricultural uses, public utilities, public parks, and recreational areas, cemeteries, riding stables, and quarries. And that is all that we have. So this ordinance would be bringing our ordinance up to date from B1 through the airport districts. And as you're familiar with, we've already went through the A1 through the R5 districts, which you've approved.
Okay, thank you, Tammy. Are there any additional questions for Tammy from the Board of Supervisors? If not, I'd entertain a motion to open the public hearing.
Make a motion to open the public hearing.
I will second that.
Okay, motion made and seconded to open the public hearing. All in favor signify by saying aye.
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 Aye. Public hearing is open. And if there's if anyone would like to speak on this matter, please do so. I would ask that we unmute anyone in the Zoom meeting and to allow them to speak. Also, you can raise your hand or contact us via chat if you wish to speak.
Chair Baker, nobody has indicated they would like to speak during this public hearing.
Okay. With that, I would entertain a motion to close the public hearing.
I will make a motion to close the public hearing.
Second.
Okay, motion made and seconded to close the public hearing. All in favor signify by saying aye.
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 Aye, carried 3-0.
I do have one other question.
Okay, go ahead.
Tammy, I know I brought this up a couple other times related to the Airbnb, the ROB. What is the current status of those houses, residents, businesses, whatever you want to call them, in Dubuque County related to our zoning ordinances?
Yeah, so Jay, I've been working with CJ a little bit on this and we're gathering information. And this would be part of my presentation that I'll be bringing forward when we do our budget. Our intention is to go ahead, I'm sorry, I'm grabbing some notes here. Our intention is to hopefully within the next 6 months, have an ordinance bringing that forward to you for that, as well as we have the solar ordinance. We have the towers we need to look at, and we'll be bringing forward to you the rest of this ordinance, which is all of the, all of the definitions and parts and things. So Jay, our goal is to complete all of these ordinance updates that you guys are asking for that have been sitting here for years, hopefully by the end of this next year. That's our goal. So Airbnb are one of the top priorities that we have on the list, and we are gathering information as I'm speaking to you, okay? And hopefully we can get something through and get this amended. I know that Denise has talked about codification and then potentially codification in another year. So my goal to have all this stuff up and going so that it's all out there. We're working hard at trying to get it all done.
Good to hear. Thanks for the update.
Tammy, I have a question for you about the matter before us for public hearing. Did you receive any comments from public or any calls?
Not
I mean,
one.
no one here before us today, but nothing? Okay,
Nothing.
thank you.
We had our public hearing with the zoning board and we had no public attend that as well.
Right, there's not really any changes being made here. We're just
No.
doing the
We're
final
cleaning it
comment.
up. We're trying to get a document that's cleaned up and there's the changes that were put into place were actually beneficial to the public.
Thank you.
Okay, and as chair, my understanding, and I know Denise will correct me if I'm wrong, but we do not need a resolution for this. There is a form that would need to be completed, but I believe we need Board of Supervisor approval in this case.
Mr. Chairman, if I may, the motions that you have accompanying this document are the same motions you have when you have a zoning hearing and you change the classification on a property of land. They are the same motions that you will see accompanying the next item on your agenda, which is the 2020 codification of the or the adoption of the 2020 Code of Ordinances. These are all the same for anything that deals with any ordinance. When Tammy brings forward a change to the zoning of a piece of property, that is technically an amendment to the zoning ordinance, to this big ordinance that you are working on with this document. And so, no, those are not, there are no resolutions or anything. It's just making these motions as you do in those other instances.
Thank you, Denise. So I would entertain a motion for approval of the ordinance.
Does anyone know where the site is? It's in it's in the board packet, the format you wish to have us follow. I have it here is
Page 76.
okay. So I'll make a motion to approve the ordinances. Mary, I
I will
hear you
second that.
talking.
Okay, there's a motion to approve the ordinances, amendment to Chapter 1 zoning, Dubuque County Code of Ordinances, and it's been seconded. All in favor signify by saying aye.
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 You need to suspend the rules to take final action on it at this meeting as opposed to hearing it again in 2 subsequent meetings. I believe that's at the top of that page.
Yeah, and that's similar to what we do with any zoning ordinance, any zoning change, any variance or change.
I'll make a motion that the ordinance be adopted and the auditor be directed to arrange for the publication of the ordinance and the official county newspapers as required by law.
I'm actually gonna rule that out of order, Ann. I think we need to do the suspend the requirement that the ordinance be considered and voted on for passage at 2 prior meetings before we do that one. So
Very good.
let's try that one.
I'll withdraw my motion and make the one you just said.
Okay. The motion, as I understand it, is to made by Supervisor McDonough to suspend the requirement that the ordinance be considered and voted on for passage at 2 prior meetings.
I will second that.
Okay, motion seconded by Wickham. Any further discussion? All in favor signify by saying aye.
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 Carried 3-0.
And now
Okay.
I'll make my motion that the ordinance be adopted, that the auditor be directed to arrange for the publication of the ordinance in the official county newspapers as required by law.
And I will second that.
Okay, motion made and seconded. Any additional discussion? All in favor signify by saying aye.
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 Aye, carried 3-0. Okay. The amendment to Chapter 1 zoning, Dubuque County Code of Ordinances is approved. Okay, we will move on then to, excuse me, Tammy, we'll go back to you for the next item. It's public hearing, Chapter 90, adoption of 2020 Code of Ordinances.
I think,
This does not have,
Yeah.
this does not have zoning issues in it. This is the adopting all of the ordinances and all of the changes you have made over the last 5 years.
Okay. If there is.
I'll make a motion to open the public hearing.
Thank you. Is there a second?
Second.
Motion made and seconded to open the public hearing on Chapter 90, adoption of 2020 Code of Ordinances. All in favor signify by saying aye.
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 Carried 3-0. We are in public hearing. And if there is anyone who would like to speak on this matter, please do so at this time. And you can do so by raising your hand on Zoom, contacting us via chat. We'll make sure that you have the ability to speak. And then if there's anyone in the Board of Supervisors chambers who may want to speak.
Mr. Chairman, I would explain that the Code of Iowa requires you to codify your ordinances at least once every 5 years. This was last done in 2015. So all we're doing is
3, 4, 0, 2, 2, 8.
I don't know if anybody else heard. I heard some interference.
I muted him.
Okay.
Chair Baker.
Thank you.
So all this does is, up until now, we have had amendments to the various ordinances. Now I will go with this adoption. I will go in and take those amendments and actually make them part of the ordinance with a note as to when that amendment was put in there. And then those will be posted on the website so that everything is up to date.
Thank you, Denise. Okay, did we have anyone to speak?
Chair Baker, no one has requested to speak during this public hearing.
Okay. Would entertain a motion to close the public hearing.
So moved.
And I will second that.
Motion made and seconded to close the public hearing. All in favor signify by saying aye.
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 Do we need to take action on this as well?
Yes.
And I believe the next, a couple of pages forward in your packet will have those same motions that you just did for the amendment to Chapter 1.
Sure. I will make a motion to approve the Chapter 90 adoption of the 2020 Code of Ordinances.
Second.
Motion made and seconded. Any discussion? All in favor signify by saying aye.
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 Carried 3-0.
I'll make a motion to suspend the requirement that this ordinance be considered and voted on for passage at 2 prior meetings.
Second.
Motion made and seconded to suspend that the ordinance be read at 2 prior meetings. Any discussion? All in favor signify by saying aye.
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 Carried 3-0.
I'll make a motion that that the ordinance be adopted and that our esteemed longtime auditor Denise Stolen, with many, many years of service, be directed to arrange for the publication of the ordinance in the official county newspaper as required by law.
Second.
Motion was made and seconded. And is there any additional discussion? All in favor signify by saying aye.
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 It is carried. And our esteemed long-term county auditor's goal of cleaning up all the ordinances for our new auditor, Mr. Dragato, has taken place. And thank you, Denise.
Is that true? Are we done, or aren't there other still remaining issues, Tammy?
There actually, once the zoning commission gets completely done with the zoning ordinance, along with, they may have another couple of sections to clean up, then we need to go back to the zoning ordinance and look at the definitions, do an amendment for any additional additional definitions, or take anything out. And then part of the process will be to go back through the entire document and make sure that all of the references match, the page references match. At the front, if you go to the website and you look at any ordinance, it has an in at the beginning showing, you can look at it and easily see, okay, this item is on this page. All of those things need to be put into place, and that will be brought to you again through the process of amendment to clean up, do the final big cleanup on the zoning ordinance. I believe there are a couple of other things then that they want to add once that is done. Plus there may be a couple of other ordinances that need to be amended in the process. And then my hope would be that a year from now, you would be able to recodify and have all of those things cleaned up, and maybe everything will be calm for a few years.
Tammy, is that the timeline that you're following? I
Yes.
understand.
Yes. So that's what I was explaining to Supervisor Wickham just a few minutes ago. So yes, we have these other parts and things that we need to bring forward. And we're also going to, in this process, be going and working on that solar, working on the Airbnb, and getting all that together. And that's my goal, is to get all that stuff, move it forward. Then we can have a whole cleaned up ordinance by the end of 2021, that it would get codified and be out there. Now, again, I don't think it's going to take us more than maybe 6 months to get this stuff into you. That would be our goal. We're going to continue working hard at it. And, but this had to be our first part of moving forward here, because this is the one that's been hanging there.
Correct. And what we have done to date, are we compliant now with the Iowa law?
Yes.
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 Okay. So we're at a good stopping point. Thank you.
We're to pause.
Good way to go.
Okay, thank you, Denise and Tammy, and for all your, and our zoning commission for all their good work on this. So
I will make a motion to recess till 12:30.
okay, there's a motion to recess
Second.
till 12:30. Seconded. All in favor signify by saying aye.
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 Aye. We're in recess till 12:30. Thank you.
How's it going, hon? All right, I'm starting another call here.
Oh, how long does that one go?
Okay, we'll convene our work session at 12:30. Historical Society funding request review. And I think we'll go to our budget director, Stella Rundy, for some information on this, some overview.
Good afternoon, everyone. Supervisor Baker asked that this be placed back on the agenda. The Historical Societies completed and submitted funding applications for our FY21 fiscal year that we reviewed maybe about a month ago at a work session. At that time, the supervisors didn't take any action to do any FY21 funding. So there's been questions from the historical societies about their typical or what they would usually get in a year, which is $720, if they would be receiving that this year or not. So we wanted to come back in front of you and bring this topic back up. There is currently no FY21 funding in our budget. Also, the FY22 applications are back out. So I've had some questions on how to complete those applications, since they did just complete these ones and weren't sure if these would be funded or not.
Okay, thank you, Stella. I guess I did, received a letter from the Dyersville Area Historical Society asking about the FY21 funding. We did have prior discussions on that and had taken no action. I just wanted to review with the board and see where we're at on FY21 funding. I think FY22 will be part of the budget with the new board. So I'd like to focus on the FY21 and see where we're at, because some of the organizations have received some kind of funding in the past and haven't received anything for this this fiscal year, and we don't have anything allocated at this point. So and Stella, I had a question. We received the applications, funding requests, and it appears as those are the FY21 requests. Is that correct?
That is correct. We had a couple of work sessions surrounding this topic, and the board had requested that the historical societies complete the application for FY21 to see what the need was.
Right. And then in addition, we put out that we wanted them to get working on their FY22 requests as well.
Correct.
Okay. All right. So I'll open it up for discussion. I'm assuming we have some guests. I can't really see them. Who's here? If somebody can help me, and if there's any of those folks that would like, they have input, I'd be willing to listen. But I first would like to have discussion of the Board of Supervisors on where we're at with this. I, would like to try to address the FY21 holes in the budgets of these organizations.
Oh, yeah.
My understanding is in the past, they have all received $720, and I think Jane Beshen, in her letter, says, my greatest concern is that we have received no payment in FY21. So I would like to address that concern. If I think in the past they've received $720, I would like to at least address that concern for FY21.
Does anyone know how we got to this point where the fiscal year 21 was not appropriated and sent? How was that an oversight? Was the board lacking there? How come if we've done it previous years, this year it was stopped?
So during the budget process, there was some requests from the Historical Society and also the National Mississippi River Museum. And I think during that whole process, the board tabled those items, wanting to know more information. As there was a new request from the National Mississippi River Museum for a program with the Conservation Department, and also a request for operating funding, and then also the request for the Historical Society's operating funding, which has been for the last maybe 5 years distributed by the Dubuque County Historical Society. So I think what happened was we wanted to get more information, or the board wanted some more information or discussion surrounding this topic. And we had a work session in like early March, right before COVID hit. And then this kind of got pushed to the side as we dealt with the pandemic.
This is Kurt. During that meeting in March, you had to stop our conversation because you had that COVID conference call. So then the discussion was we would meet later, but it wasn't because the supervisors didn't want to meet with us. It was just because you had that COVID priority call, and we then left.
Okay, thank you. That helps.
So I guess I'm going to comment. This is Supervisor Baker. I don't think it was our intention not to provide any funding for the historical societies for all the small towns and for the Dubuque Historical Society. They have a request in as well, and they've received funding in the past. And it's, some have modified their requests for FY21 and may have other ideas, for FY22. Again, that I think FY22 is clearly a budget decision for the new board. But for FY21, I would at least want us to consider providing the previous levels of funding for the organizations for FY21. And
if we stay on that thought, and what is that amount, and where are those numbers?
Dubuque County Historical Society. Excuse me, I'm looking at what they requested. I believe it's $17,500 for the Dubuque County Historical Society. The Dyersville Historical Society, Epworth Community Historical Society, Farley Area Historical Society, New Vienna Historical Society, Tri-County Historical Society, and Dubuque County Historic Preservation Commission. I believe, and somebody correct me if I'm wrong, have received $720. I think the Historic Preservation Commission may have received $900 previously, and are asking for a $100 increase. So, Stella, I don't know if
this year we have given the Dubuque County Historical Society, we've made them a $50,000 gift. So we did that. They have been addressed. I mean, what I think we need to see before us is that the needs of our smaller historical societies are significant and they are languishing. Those organizations need to a little bit of help and some attention from us to help them maybe survive regardless of the pandemic. These issues aren't necessarily from the pandemic. So, I see there's two things before the board today. We could make the same things we've done before, $720 to those 5 organizations or 6. The Historical Society for Dubuque County has already received a $50,000 grant, and on we would go. Or we could begin a conversation about how can we do this better. There was discussion about creating a committee, about getting together and looking to see and address what the needs are. The needs of someone publishing a quarterly newsletter would not be the same as a historical society that needs a roof repair. So, trying to balance out what the needs are, and I think we could be a vehicle to build communication between the Dubuque County Historical Society and the aquarium, the Mississippi River Museum and Aquarium, and the other smaller community, historical societies. There certainly is a need, but how do we address it? That's kind of where I think we left it last, which is, I don't know, how much money are we thinking about, and who should convene this group. Jane Beshen, who is the president of the Dyersville Area Historical Society, has volunteered to be on any committee that might look at this. and to actually look at developing a relationship with the Dubuque County Historical Society and specifically with River Museum. I had yesterday a conversation I thought was quite interesting with Aaron Dragato from the River Museum. So, you know, I don't know that we want to necessarily, I mean, maybe we do. I would prefer not to just start putting money into this before we have some kind of idea what that structure might be. My thought would be, if you want to address, you know, the $720 or $900 for these folks to move them to the end of fiscal year 21, I'm sure that they certainly aren't happy with my help, because so far since I've gotten involved, they've all lost money. So that's no place for anybody to be, but to look to our, you know, to look to our major organization who has that lift to say, what would a proposal be from you to, you know, I'm not asking you to do it for free, to give some time and attention and professional staffing and pull together a committee of, you know, these all have governing boards. So there'd be a representative to just generally maybe meet by Zoom and just start having conversations about what is the ongoing need. I don't want any of these to fail, but I worry, and I know that there's aging members of the leadership groups in each of these organizations. And so it might be an opportunity to redirect conversation, not simply brush it off, but to say, how can we work to get, to have all of them thrive and, you know, be part of each other and to wish for everyone's success. So that's my thought. You know, if we want to make motions and do the $720, no one's going to object to that. But we should probably be looking to ask the, you know, the Aaron Dragatos and the Kurt Strands to say, will you help us try to get some kind of communication ongoing? And what can you do?
And I would just want to echo that, Ann, thanks. You know, we as a historical society really take our job seriously, in that we do want to wrap our arms around what's happening in the county and help those in need that need either just professional development or having a conversation to help assess what's going on. And you know, we are all working together, whether we know it or not. I mean, we are all a part of the same county. We're talking about similar history here. And part of our proposal, that 17.5, in it suggests as much, that we would serve as a mentor to or a convener of conversations around these topics, and maybe to assess how we can bolster everybody who's working together. So we're happy to be a convener, and we are happy to lend our professional services however we see fit, or however everybody sees fit. I think starting a conversation is wise. However, the money needs to be handled, though, now it is sort of up to the supervisors, but we are happy to play that role.
So what do my colleagues think then about the wisdom of, into the new year, allowing the River Museum to maybe bring us you know, the Dubuque County Historical Society, more of a convener role, and to reach out to these folks that are on their, you know, they're on the documents as people who've completed the application for us, so that we're ready for fiscal year 22 process. You know, that's what we need to do, is to look ahead and not just try to go back and fix what we've maybe not done well.
I will jump in here, and Supervisor Baker, and I guess I want to ask Aaron and Kurt. I believe that the proposal from the Dubuque County Historical Society was the former 22,000 less the amount of money that was given out to the county historical societies, equaling 17.5. So the message that Aaron just gave is not the message that I received. To me, it was cutting ties with them, and I may have, at least in a financial way. So my reason for bringing this up is I think we left a hole in some of these small organizations that are run either by volunteers or extreme part-time people, good people that are trying to, keep it going. And if the Dubuque County Historical Society or the National River Museum Aquarium, if they have ideas about, being a convener, I think that sounds great. I want to know, what do we do for this year? I want to make sure that there's some funding. Now, if my counterparts don't agree with me, I'll shut up and let them handle it. But I received this letter from Ms. Beshen, and in it, she says, again, my greatest concern, we have received no payment in FY21. And so they have not received what they have received in the past. And previously, I think there was discussion, and Ann, you can correct me if I'm wrong, about maybe looking at it like we do the Hancock Memorial Grant, convening a committee, from all the historical societies, and have them work on this. If that might be a little bit of heavy lift, and I would say the best organized group, if you will, is also the group with the biggest budget, and that makes sense. They have full-time staff to help with that. So I'm not opposed to that. I just don't know if that's the answer for FY21.
Right, but to
By the
get
time
to this,
you figure out the shape of the table for the committee, you'll be into FY20, dealing with FY22 funding. So I would like the Board of Supervisors to consider at least doing what we did, in the previous year, and then let the new board and decide if how they want to handle this, whether it be by committee or having Aaron and Kurt and be conveners and help these other historical societies succeed. I don't think that's really been happening, but I don't think it's really anybody's fault. I think they have decided to, the other historical societies, have hollered for help, and I'm listening. And I think Ann, I know you've had discussions, and I assume Jay is concerned as well. So,
Jay, what are your thoughts? Could I ask?
I certainly would like to engage members of the public that are a part of these historical societies. So that's where I would start, and I would like to hear from them on what their needs are and how they would like to organize. I don't like having a board say, hey, here's how you should organize. I would like to hear from them on what their needs are, and if they are just financial, then that's easier or hard when we look at it, but it's pretty clear cut. If it is organizational, and or we need more of a support group and we need to revamp the system, I'd like to hear from them.
Right. Can I ask, did anyone in our office reach out, not by email, they don't all have email. Did anyone reach out and invite someone from every one of these organizations to be here today? Stella, did you do that? Dawn,
I see a
did
couple
you do
online
that?
right now.
I did
Yeah.
do that. Yep, I've reached out, and again, this morning I sent out a reminder. So I've had conversations and also emails back and forth with many people.
Okay, so do we have someone here from each of these organizations?
Many. If the chair can get them to speak, I would be very interested in listening.
I would very much like to do that. And I recognize some of the names. Some are board members. I recognize the name of Betty Stuffel-Mauser, and
Jane Beshen is here with us again.
Yeah,
I think this is
Jane.
her third time.
I'm scrolling here. I don't have a full screen of the names. So
Stella, who do you
just-
see here?
I see
I
RRS
see
Stewart.
RRS. I see Jason, I believe May be here for,
They're both here for the same organization.
Yeah, Jason and I are both on the Dubuque County Historic Preservation Commission. It might be simpler if you just call out the name of an organization, and then if someone's here, they could go ahead and speak for that organization at that point.
Okay, we have Jason Nisus in chat. I'm here. He says, I'm here on behalf, I lost it, of the Historic Preservation Commission. Okay. We have,
well, I see Jane Beschen. We mentioned her name 3 times. So maybe, can we start with Jane?
yeah, Jane, can we make, allow Jane to speak here? Jane Beschen?
I think she's trying, but we can't hear her. You have, Jane, you're having some audio problems.
She's unmuted, but we can't hear her.
Is she on my phone?
no.
No, she's
No.
video.
Okay. All right.
How about from Cascade? Is anyone from Cascade? We'll give anyone from Cascade on the phone, we'll give them the floor.
Okay, how about Epworth?
That would be me, Betty Mauser.
Okay, Betty, do you have any comments or any questions for us?
Not at this point, no.
Okay, thank you.
Betty, would you be interested in being part of a committee if the River Museum did convene the historical societies? Do you find value to maybe working together to form a partnership?
Myself personally, I don't think I would at this point in time. We've got to do some kind of reorganization of our historical society as it is. We've got an elderly population that's the true historical society. And then we have a subcommittee of about 5 people who handle a quarterly newsletter. And those 5 people work pretty diligently. We are very successful with that. Not as successful at getting other people involved into the historical society itself. Something we'd like to do, but I'm not sure exactly how to go about it.
What do you do with the $720 that the county's been giving you?
We use that. We print 4 quarterly newsletters throughout the year, and each newsletter costs right about $720 to print and mail. And so so the $720 from the county pays for one printing of that.
Are you satisfied with the $720 then?
At this point, yes.
Okay, so there's an easy one. All right. Carla Thompson, I see your name. And what organization are you with? Did we lose Carla? No, she's here. She might be by phone. Could anyone?
I think if somebody's on my phone, they have to *6.
I mean, what does it do different than an office?
It makes it
I think we're starting to get some folks coming on for the next work session, the Sunnycrest Manor work session.
Beth Kress, are you here for the Historical Society?
He's here for Sunnycrest.
Sunnycrest Manor.
I can tell you the list that I sent it out to. I was just scanning the group to see if I see any of these people. For Dubuque County, Kurt and Aaron are both here. Dyersville, Jane Beschen. Epworth, Betty Mauser. Farley, I had Lynn Conzen and Jeff Simon, and I don't see either of them on here unless they're a phone number. So they would need to, excuse me, unmute themselves. Marion Klosterman for New Vienna. Tri-County, I had a Nancy Dolphin. And for the Historic Preservation Commission, I have RRS and Jason are both here.
Well, let's hear from RRS and from Jane. They're both present.
Okay, yeah, Jason, but I can go ahead and start. So I'm chair of the Dubuque County Historic Preservation Commission. And so we're a county commission, but we're being treated like we're an outside organization. And some of that goes back to when the commission was created in 1987. We weren't assigned to a department. And so the county was kind of outsourcing historic preservation to all these various historical societies that you're talking about now, primarily Dubuque County Historical Society. But then there were some retirements early in the decade that kind of led to us being forgotten about. So in 2015, there was a memorandum of understanding between us and the county and the other historical societies that established the funding levels we're talking about now, the 17,500 to Dubuque County Historical Society, 720 to each of the smaller historical societies, and $900 to the commission. But that MOU ended this year, so I think that's why we're in the position of discussing funding again. But as a commission, my main concern is that we're not assigned to a county department, so we do have to apply for funding as if we're an outside organization, even though we're technically a county commission. Like, you appoint our members, but we're kind of treated like we're not really a part of a county. So that's just my thoughts and perspectives, but we'd really like to get that resolved in some way so we get some sort of staff support, because really the only thing we get from the County Historical Society is basically an accounting service. Like, they write checks and stuff for us, but they don't help take minutes or do any of the other things that staff do for some of the other commissions.
How many checks do you write that they need to run through the River Museum?
Well, so we have, so there are 5 areas that the State Historic Preservation Office, called the SHPO, kind of directs certified local government programs like the county commission to spend their funding on. So one of them is membership in historic preservation organizations. So we're members of the National Alliance of Historic Preservation Commissions, which is, as it says, a national organization for sharing information between historic preservation commissions. And they, as I get the emails and the information, I pass that on. That's a relatively small part of our budget. It's, $50 membership to that. And then also we're part of the National Trust for Historic Preservation and the Preserve Iowa. So we've got $50 memberships to each of those organizations.
So can I just, RRS, I need to interrupt because we are going to run into a 1 o'clock meeting here, but do they write maybe 5 administrative checks for you a year? Is that what they do for the bulk of the service?
Yeah, I'd say maybe 5 or 6, because
Okay.
the other stuff is just reimbursements of expenses we send either on programs
Sure.
or for training.
Okay, so you need a little more help than just a check. You need some background and support, and I think that Aaron can look into that for us, I hope, and see who can do what to do that. Is $900 sufficient for you?
Well, we asked for a slight increase in our budget application to $1,000, as Dave already pointed out. And I
What
think,
did you do with your funds last year?
well, we had those memberships I already talked about. We also we were going to spend a big chunk of our funds in the Preserve Iowa Summit, which was scheduled to happen in Dubuque. So, as I said, most of our funding we try to either spend on programs or trainings, because there's a training requirement. The Preserve Iowa Summit was hosted by the city of Dubuque, but the City Historic Preservation Commission reached out to us and asked if we'd be partners. So most of our $900 last year was going to be spent on that. However, they had to go virtual, like almost everything, which actually brought a reduction in funds. So we ended up not needing to spend as much money on that. So we were able to carry some funds into this year, which we had looked into us using for a different program. There's a traveling exhibit coming to the Carnegie Stout Public Library about African American It's in Iowa and their relation to the suffrage movement. We're hoping to work with the Kennedy Public Library to get that at the Kennedy Public Library.
So what is
that's
the
what we're
budget
gonna
in,
use our
what's the
excess-
budget in your account, RRS? Do you have money, or did you give money away, or do you need money?
Well, right now we have $650 that was not spent last year because of the change in the Preserve Iowa Summit. That's what
Okay.
we were hoping to use to do this exhibit in conjunction with the Kennedy Library. So if we had to, we could probably survive off of that, just reallocate some of that money and either don't do the exhibit or scale the exhibit down. You know, but we were hoping to get the same level of funding for next year at least.
Okay. And then is anybody here from, we don't have anybody here from Farley. Jane, what do you wish to add? Did we get Jane Beshan?
Yes, can you hear me now?
We can, thank you.
All right.
Jane.
So, first of all, I did not receive an email on this meeting. Tom saw that this was on the agenda and he gave me the information to get into the meeting. But our problem in Dyersville is mainly that we have this, the oldest building in the city, which was started by Mr. Dyer, who Dyersville is named after. So the museum itself is hard to sustain because of its age, and we're constantly doing repairs and so forth. This year, because of COVID, you know, we were closed the first few months, and then the numbers have been way down. So, you know, our funding this year is much lower than any other year. But in general, we have an employee that does a fantastic job because we also have an office that does genealogy, and that person takes care of all of that too. So our main funding comes from donations, and we feel that $720 from the county is not near sufficient for what we give back to the county as far as tourism and people that draw. You know, with Dyersville having all of its the Field of Dreams and the Basilica and all the other attractions, we need to be part of that, but it's hard to do it on such a slim budget.
Okay, so Aaron, that's the task before you.
Well, and we're happy to take on that task, I suppose, and we'll figure out the gory details, but, back to Dave's comment about doling out the money. I don't think that was ever back on the table, by the way. What our request to the county in this 17.5 is to be that convener. And the county has now decided, according to what I recall, decided to take on that doling out of the funds for 21 role. So I just wanted to clear that up. But yes, we are ready and very willing to help those who want help.
So that I understand it, your request for the $17,500, would that, for fiscal year 21, would that include the work to be the convener, to bring together these organizations and to assess what they need to go forward?
Exactly right.
Okay. And Jane Beshan would be, I think we've got some folks who are very interested in doing that, and others probably, it sounds like, not so much. But
Okay, thank you. We do have another work session. I guess I would want to hear from Ann or Jay if they want to make any recommendations today or next week on FY21, or at least, tell me that there'll be a commitment to addressing FY21 as well as FY22 if it goes into the next board. That was really my concern. And I was, of course, reacting to Jane's letter and realized that, we had not brought any conclusion to FY21.
So my thought on this would be that if we can reach consensus that in fiscal year 21, we will do what we've done before. And that includes the 17,500 to the River Museum to act, to the Dubuque County Historical Society to act as a convener, that we could take action on that at next week's meeting. It could be put on as just to duplicate what we've done in the past. And then to move forward into 2021, getting ready for fiscal year 22, we would ask that the Dubuque County Historical Society convene, and that we'll get a future update report from you, maybe within 90 days, certainly, to know kind of a better summary of where we are. Does that seem like we could be a consensus on that?
I would support that.
I would support that as well, Ann. So I think it sounds like we have consensus for FY21 funding, and then I have confidence that the new board will work with the Dubuque County Historical Society to, come up with a better plan for going forward. So, okay.
So that'll be back on the agenda then for Monday to take action.
Yep, sounds good. Okay, Stella,
everyone.
Stella, did you understand what we're reaching consensus over?
Yes. Yep.
So for next Monday, it should say, at least say possible action on it, because we have reached consent.
I'd prefer a resolution on that. So if we can create the document and the paperwork for a resolution of what we just discussed, that would be very helpful.
Agreed.
I agree. And I'm not sure who this is from. It says, yeah, I don't think this is accurate. It says this, because I asked earlier, the 17,500 for Dubuque County, the Dubuque Historical Society was 22,000. It wasn't 17,500. So that the 17,500 does not include the amounts to be given to the smaller town entities. We're going to do that individually. So somebody in chat was asking about that.
That's correct.
I'm clarifying that. So I think Stella understands what we're looking for. So we'll want a resolution with that in mind. And Stella, if you have any questions, you can discuss it with the supervisors individually, just to make sure there's no confusion, but I don't think there is. So, okay, thank you all very much for joining us. I think it was productive, and wish you well going forward.
Thank you very, very much.
Yeah. Okay, good discussion. Thank you all. All right.
Thanks, everybody.
Next up, we're running a little behind, but we have a work session to discuss Sunnycrest Manor. And I asked for this work session, and we have our interim administrator, Tammy Freiberger. We hear from her weekly in our meetings and daily with updates, reports. Then we have we have our elected officials that are the hospital board of trustees that control the buildings and grounds at Sunnycrest Manor and do a wonderful job. And the the Sunnycrest Manor Operations Board, and Craig Takus is the chair and does a great job with that organization. So just wanted to kind of, with COVID, we've been basically playing defense all year with, I would say, leading the way for other area and regional nursing homes on how to handle this pandemic and how to stay in touch with family members. As you recall, early on in the pandemic, we had some of our long-term care facilities that we were getting complaints that they weren't in touch with family members and they weren't very transparent. Such has not been the case at Sunnycrest Manor, and I think this goes back to Chris Kirsch's leadership, and I think Tammy Freiberger has grabbed the baton and done a great job going forward. So I'm gonna open this up. I guess I want to see if Tammy and any of her staff have any comments they want to make on what's going on at Sunnycrest Manor and bring us up to speed other than on other things other than reporting on COVID, which I know may be difficult. And then I'll ask Supervisors McDonough and Wickham if they have any questions, comments, or if they want to reserve that until we hear from the Sunnycrest folks.
Hi, I guess I can start this, and then I've invited the team of Sunnycrest to be part of this conversation as well. I just want to start off with thanking the Board of Supervisors for their support in our being, our mission, offering recommendations to us and asking questions that continues to assist us in leading and sustaining our operations. Not only that, but we appreciate the public, the community, and the family outreach where we felt that ongoing support, whether it be through words, encouragement, cards, donations, or the activity involvement from our advisory board to the Board of Trustees, to the auxiliary board, Sunnycrest and its residents, families, and our staff couldn't thank everybody enough for that support. We have had our challenging times. We've had our COVID outbreak most recently, and it affects our resident lives, the interactions, as well as the staff. In our most challenging times, Sunnycrest facility, its residents, the families, union staff, and management staff. I feel like one of our biggest successes is that we all pulled together to focus on the most important thing at Sunnycrest Manor, and it is the care of our residents and our special population of residents that we serve in that regard. We can't begin to thank our families enough for their unwavering support of their loved ones and our staff. We've also felt the outreach of strangers and other facilities. I know I can share a couple nice things. I know I share a lot about COVID and numbers and vaccinations and things like that. And Beth can go into some further things as well with our activities, but we've had perfect strangers donate things to us and reach out to us at Sunnycrest Manor. We've had artwork donated to us, and we're going to have an art show for our residents so that they can attend a real live art show. So we're doing a lot of things at Sunnycrest despite some of the challenges that we've been given. And we have a lot of talent here, a lot of appreciation for every single staff person at this facility. And like I said, the Board of Supervisors as well. I know that finances have always been, a concern, and we're always looking for ways to obtain grants, looking to make money in ways for reimbursements. We're participating in an ECHO program where where we're learning and doing things like that, but the facility is going to get $6,000 for participating in that. Plus it's a set of knowledge and skills that we can utilize in our everyday life here at Sunnycrest Manor. Lots of wonderful things going on, and I'm going to let Beth go into a little bit more of that, but that's some of my highlights that I wanted to share with everybody.
All right, I want to echo Tammy's thanks to everybody, the board, and all the perfect strangers who have donated so many wonderful things to Sunnycrest through the year, especially Dubuque County, Dave Kubek and the assessor's office and the personnel office kind of teamed together to do a drive on Facebook, not only for special items our residents could use, but also a financial drive for our Sunnycrest Auxiliary to use throughout the year to spend on our residents. And that's going well. They're almost to $5,000, which is a record. And I was asked, how are the residents doing at Sunnycrest with all that's going on with the pandemic? And all in all, I think they are handling it well. They've surprised us. Some of the ones we thought wouldn't handle it well are. Some have grown quite comfortable in their rooms and with less structure in their day. And some miss the structure and the ability to move freely throughout Sunnycrest in our community. And we look forward to a day when we can do that again. Do they miss going out with their families and hugging them, especially at this time of year? Absolutely. But is Sunnycrest doing all that we can to help them through this? Also, absolutely. One way we are making it possible for residents and families to connect is through our Chatterbox, which is pretty innovative at Sunnycrest. We, sorry, I actually have the day. Just a second here.
Can you hear us, Beth?
Yes, I can hear you.
Okay. Don't worry. We've all had,
Sorry.
we've experienced lots of different Zoom issues over the pandemic.
I'm sorry about that.
You're
The
either
dog
working
kind
at
of went
home-
nuts. I'm off at home today and the dog just went nuts. Somebody came to the door, so I'm sorry for that
I
interruption.
thought maybe we had a new policy at Sunnycrest where we could have therapy
No,
in the
no,
house.
I'm off today, so I'm home and I tried to make it so silent, and once you know, that came up. But anyway,
That's
I
right.
wanted to mention the Chatterbox that was built by our maintenance team, and it allows families to actually enter Sunnycrest through our family parlor. It's built out of plexiglass and glass and wood, and residents and families can sit right next to each other. I mean, they can basically touch hands through plexiglass. It is scheduled how they visit. We do have visiting hours, but we've definitely made arrangements for special birthday visits. There will be visits on holidays. That has been awesome. And that's been a wonderful team project at Sunnycrest. December is always the busiest time of year in my department. And even with a pandemic, it appears no different. Lots of fun things have been planned for the holidays, and pretty much all the staff have been on board helping with things. We have had special dress days for residents and staff, crazy hair day and crazy holiday dress day. We shared pictures of those on our Facebook. We took special holiday photos of residents that we will be sharing with our families. In fact, many went out in the mail a couple days ago. And one of our social workers has a professional camera and brought that to work, and it was really fun. She did a great job and spent a lot of time editing those photos. So those are perfect for a Christmas special treat for our residents to share with the families. We have lots of Christmas crafts going on, from door wreaths to homemade ornaments and more. This past week, we made our bingos, which everybody probably knows. Bingo is probably one of the most beloved activities in any nursing home, but we made it Christmas themed and retraded our numbers for Christmas symbols such as trees and elves. We have done lots of Christmas card writing, including the completion of a semester-long pen pal program with Clark University with one of their social work classes. Throughout the semester, we were even able to meet the pen pals via Zoom. So that was a really cool opportunity and partnership for residents in our community. Zoom has been great during the pandemic. We've had Zoom Christmas sing-alongs, Bible study groups, rosary, even within our facility. A resident leads it in his room, and then other residents throughout all our facility are able to partake via Zoom. We've done virtual Christmas light rides. We were even able to tour Dubuque's Reflections in the Park via YouTube, actually. Local musicians like Elizabeth Mary have provided links to special Christmas programs that we have put on in the villages. on the TV and activities, we were really thrown a curveball as far as technology. And I think we've risen to the challenge, many headaches along the way, but we use our iPads for basically everything now. In fact, we have been busy the last week or so recording a virtual Christmas concert with residents. And as long as I can get the technology to work, we will be posting that tomorrow or the next day on our Facebook, where we had different residents sing songs, different than what we usually do. We usually do a Christmas choir collectively with several residents, but we've had to morph and change things. And so this is what we did this year. There are lots of treats being handed out to residents, especially this week, with many made possible by that Dubuque County drive for special items. Many of those items are also being used for their Christmas gifts, along with donations from area organizations. Speaking of Christmas gifts, my team has spent countless hours to organize individualized gifts for each resident at Sunnycrest. We kind of act as the elves, and our nursing department will team up and play Santa as they will dole out the gifts on Christmas Eve. So that isn't new this year. That's something we've done for several years, but I think residents are really looking forward to it this year. And it will be, the gifts will be a little different this year because they'll be able to utilize the gifts into the new year. I don't want to give out too much. I want them still to be a little surprised for Christmas. And staff from other departments have brought us ideas also for the season. A Sunrise staff suggested Elf on the Shelf, which has been a simple and fun hunt each day for residents in all our villages and Sunrise. Today, many managers and staff were busy putting merry messages out along our grounds. And our social worker came up with that idea of having staff, families write a special Christmas note to our residents. They picked up a sign from us, and then they decorated it and brought it back. And a couple family members even made signs for the staff, because I mean, this pandemic has been just trying, challenging on the staff, and they deserve some special thanks also. So we thank the families for doing that for the staff. And in all of this entire pandemic, I have thought a lot, and even just thinking about what I was going to say today, about how it takes a village to raise a child. I think especially during the pandemic, we've proven at Sunnycrest, it takes a village to care for our residents. I'm proud of our staff here who have shown up day in and day out of this pandemic, and many days jumped in with tasks far outside of their job description. I can speak to this specifically for my department, and I know every other manager can speak to it specifically within their department. But in mine, I've had staff pulled to work as CNAs or in dietary when those departments have been in need. We pass laundry, we've helped residents tidy rooms, all while continuing to offer numerous recreational opportunities for residents in a completely different manner than we did before this pandemic. I'm proud of our staff, I'm proud of our residents, and I'm proud of Sunnycrest. And I think we'll make it another great Christmas for the residents. And thanks to everybody. And Dave, I want to especially say thank you to you. We're really missing you this time of year. Dave always makes a point to come up and do a Christmas party. We've seen the other supervisors there, and our friend, Mr. Renison from Veterans, we miss you all. We hope next year you can come right back. We did have a Santa at Sunnycrest, though. One of our nurse managers dressed up as Santa, so that was great.
The new man that got hired.
I'm sure the Santa wasn't near as chubby and jolly as as the one we've had previously. Thank you, Beth, for the great report. And I know we have Ann Cowder and some of the other managers. I'd like to give them a chance to jump in if that's okay. Are they unmuted?
I'm still here.
Okay. I had a note that we have managers gathered together. So I don't know if anybody wants to talk. Hi.
Hi, Dave.
Hi, Joel.
Yeah, if I could take a moment, I'd like it too, as Beth, just appreciate the support we've got from the Board of Supervisors and the work they do. And Dave, congratulations on you, getting retirement and for being a friend of a friend. And Harley, if you're listening, we look forward to working with you as well. As Beth said, she pretty covered everything. The chat box, I would just add a couple more things. We had to really apply for the fire marshal, the state approval and everything. So it wasn't like we were just able to put this in the building for our residents. My only regret on it is that we couldn't do it sooner, but all those things take process. Up to that point, we had a tent outside with a heater in it, but it's getting that time of year where the residents, we can't be bringing them out in the cold. We got enough people sick, so. But like Beth said, we've all done our share. We've been working in the kitchen. We've scrubbed floors. We've done everything. We've all never been working at home much at all. We've been here, and hopefully our residents and their families appreciate our hard work, and you guys as our supervisors as well.
Thank you, Joe.
I think we can all say that it truly is, we've all been in this together. So from families and residents and staff, and we've felt so much support and couldn't do it without everything that we had.
This is Chuck Westfall. Could I say just a couple words, please?
Sure. Yeah, go ahead, Chuck.
Our daughter was at Sunnycrest. Linda and my daughter, Dominique, was at Sunnycrest from December of 16, and she passed just this November. And there aren't words to express the kindness and help that all of the members at Sunnycrest provided us as a family through the pandemic and before. It was a very hard situation, but they helped us get through it. Ann Kiter was just absolutely wonderful. Beth helped us to get Zoom meetings with Dominique before she passed, and they allowed her to come back from Unity to spend her last couple of days so that we could be with her. This was just a tremendous gift to us. We hadn't been able to be with Dominique since March, and Linda had gone up every day before that. So we just want to give our extreme thanks to everybody involved at Board of Supervisors, everybody, for supporting this great organization. On a personal note, I would like to, I know that you put out for application for nominees for the advisory board. Jay knows me. So if you think that I would be qualified, I would appreciate an opportunity to serve.
Chuck, I would just ask that you go on the website, and the form is on the website. Fill it out and send it in, because we've had at least 4 vacancies on the Sunnycrest Manor Board of Directors. And so we're looking for folks, citizens to join up with that volunteer committee.
Okay, I will gladly
we
do
would
that.
greatly appreciate you with your experiences sending in an application.
I will get that done. Merry Christmas to everybody.
Merry Christmas. Thank you.
Thank you. Chuck,
Merry
I would
Christmas,
just,
Chuck.
yeah, just also, if you want to phone in about the application, you could visit with Dawn Sherman. I know sometimes folks go to our website and try to fill out the form, and it's not always as slick as maybe IT wants it to be, or that I think
Sure.
it should be. So just even
Give me a
following
pen.
up with Dawn Sherman.
Dawn Sherman.
Yeah, she's our HR administrator at the county, and she just came on screen now, and she'll help you get through that process, but we would certainly welcome your application.
Okay. Do you have a phone number by chance?
Hey,
Hey, this is Emily at Sunnycrest. Chuck, I have your email. I can just email the application to you.
That would be great.
Okay.
Thanks.
There we go.
Thanks,
Thank
everybody.
you, everyone.
Yeah.
Okay, do we have any other Sunnycrest managers? I know we have some family members of residents from Sunnycrest that are on. I know Joan Geezy is on. I know, Joan, if you want to speak. And then we have, I know some other family members, and then we have our we have our trustees represented and the aforementioned Sunnycrest Manor Operations Board. And also, I see Sally Portson on. She's on a couple of the committees, and I think represents the auxiliary as well.
I'm Beth Chris, and I just want you to know that I have a sister who is a resident at Sunnycrest, and probably the most outstanding thing is how well the staff makes it possible for life to not only go easy for the family, but my sister has such a positive attitude most of the time in being a resident there, and it would never happen except for the fact that we have such a great staff. There are so many other things that I could say, but I just appreciate how her life has had quality of the last 5 years. Thank you.
Thank you. Okay, I know Craig Takis is on. Craig, do you have any comments?
Oh, thanks, Supervisor Baker. I appreciate the opportunity to be here. I'm not going to take a lot of time. All I really want to say, we've been meeting regularly, and we do need additional members. And Chuck sounds like he would be a great addition to the operations board. But I just really want to thank, Beth and Tammy and Ann and Joe and everybody else who's up there who's just done such a tremendous job. And it's really it's a great a testimony to the value of Sunnycrest to this community, the value of Sunnycrest to the residents and their families. And I just want to say thank you.
Craig, a big thank you to you for your leadership with the committee. At times, it seems like we've been a victim of our own success. We went from having 100 issues to deal with and talk about when it was first established to, I think, what really is a smooth running facility. And that's, I think, all about the administration and staff and leadership from the organization. That includes you and also our board of trustees as well, and the commitment from the board of supervisors. So thank you. Okay. Anyone else care to comment? All right. Well, thank you all so much. Again, it's great to hear about Sunnycrest Manor and the residents and how it is a family atmosphere at Sunnycrest Manor. So very proud to be associated with Sunnycrest Manor. So. Okay, I think we have Sheila is trying.
Baker?
Yes, go ahead, Jay.
I was just going to say, I'm sure there's out of this group, I've been really impressed with the conversation and those contributing. So I'd like to hear more if we can allot another 10 minutes.
Of course. And we do have, we're scheduled till 1:45. So let's,
Hi, this is Sheila. Can you hear me, Dave?
I can hear you now, Sheila. Go ahead.
Yeah, I'm Sheila Frank. I'm the chairman of the Board of Trustees. And first of all, I would like to encourage all of you to like Sunnycrest on Facebook. We have a lot of things going on, as Beth told you, and we're doing a lot of things a bit differently than we had to do them before, but we still have a lot going on and the residents are engaged. And if you like us on Facebook, you'll be able to see some pictures and you'll be up to date on all the activities that we have going on. Secondly, as has been said before, the staff has done an outstanding job. You're understaffed, they're overworked, and they have never ever let the care of the residents slip or fall through the cracks in any way. So our COVID numbers are low, and speaking on behalf of myself and all the other members of the Board of Trustees, we are very, very, very proud. Also, I see Mike is on. Can let Mike give a little update about some things that the auxiliary has been doing to show support for the staff.
Yeah, okay. Can you hear me?
Yes. Yeah.
Okay. Our auxiliary is not we've been meeting through Zoom and that, but we've been supporting Beth and her wants and needs up there, and also trying to do some things for staff to show appreciation. The public's been very generous to us this year. We haven't had to go begging. The money's just rolling in. So we appreciate that. That's it.
Thank you,
Mike. Dave, this is Sally Portson. Just as a family member and on these two different committees, I just want to say how proud I am of Sunnycrest too. My sister was never for want of any attention, and even with COVID, we had a lot of one-on-one FaceTimes, and I can't say enough how good the staff has been to our family. Thank you.
Thank you, Sally. Thanks for all you do for Sunnycrest.
Thank you.
And also Sheila and Mike and all the other volunteers and elected officials in the case of the trustees. So yeah, I think this Sunnycrest Manor is one of the reasons I ran for office. So.
This is Sally Frick.
Yeah, go ahead, Sally.
I have been associated with Sunnycrest all my life. And I want to thank you, Dave, for supporting us at a time when we really needed the support of the entire Board of Supervisors. We're going to miss you. I also want to say, as a former social worker, I used to say to people that Sunnycrest was the best nursing home in Dubuque because I was in and out of all of them. You know what? I haven't changed my mind. It is still. And we have been so lucky with this whole COVID because of dedicated and wonderful staff. And thank you all for what you do. I'm proud to be a member of anything to do with Sunnycrest. I'm done.
I forgot to unmute myself. Thank you so much, Sally.
And I just want to add, this is Tammy again, I just want to add, a thank you to all the supervisors. And I also look forward to working with Harley as well, joining the Board of Supervisors, during these difficult times and being staff challenged, as somebody had mentioned. The Board of Supervisors has been extremely supportive of us when we initiated our basic care aids, and initiating that and supporting that and being like, what do you need? That allowed us to move forward as well. I think that we can all agree that in all departments, every single staff person. It was management and staff working side by side with one another. And I think that that's one of the things, some may look at us and we're a union, we have a union facility here. But we worked side by side and we worked together doing the exact same thing. It was residents first. Didn't matter which position we were in, it was take care of the residents. And so I'm so proud to be part of a facility like that where the residents are number one and everybody comes together to work. So I know we've had some challenging times in the past, but I do thank you because Sunnycrest is, it's a pretty unique place and we take care of a pretty unique population. And our staff is pretty well trained in their specialty areas. And I'm pretty proud of that. We've seen some resident circumstances, that have changed over time, and it's because of the training that our staff has. I don't really think that there is another nursing home like it. And I could be a little bit biased because I simply just love Sunnycrest. But I do truly, when you get down to it and you look at the clientele and the needs of our residents, they do have some more specialized needs and we do serve that avenue of the population. And I think that every single staff member here can say that they're so proud of that. You don't get staff who've worked here for 21 and 30 and 40 years and not really love what they do. So thank you to all of you and your support of us. We've had, like I said, we've had some trying times and we just continue to move forward and be responsible with funds and everything else, to make it work for our residents, to make it work for the staff, and everything else. So I think you have a bunch of cheerleaders up here on the hill.
Thank you, Tammy.
Can I have to say a quick word, Supervisor Baker, Representative Eisenhart?
Go ahead, Chuck.
Thank you. It's been almost a year now since Senator Yoakum, Representative James, and I have had a chance to visit the facility. I think it was back in January, and this might have to do for a Christmas greeting today. But I just want to add my voice to how proud we are to have Sunnycrest Manor as part of our community. I think you've excelled in your response to very challenging times over the last 9 months. And frankly, I think it's a testimony of how it's important to have publicly owned institutions to take care of our most vulnerable. Because I think knowing that there's going to be visibility, transparency, and public awareness of what's going on there leads you to overachieve in terms of your performance and your accountability, knowing that people are watching. And I don't think that that's true in many other facilities where I've heard feedback from family members that something as simple as just finding out what's going on in the facility, much less continuing successful interactions with their loved ones, is possible. So I was very impressed by Beth's accounting of all the things you're able to do to keep life going on in the facility as much as possible. And that does not go unnoticed by your elected officials at the state level. And I just want to let you know that even though you aren't seeing us as much, we're still here to help you in any way we can going forward. Thank you, Dave.
Thank you, Chuck. Okay, do we have anyone else that would like to talk? We are at 1:45, so I'll kind of do last call here. Pardon the pun, but if anyone else has anything, otherwise we're going to move into our next work session. Thank you all so much, and I know that the Dubuque County citizens at Sunnycrest Manor will be in good hands. Keep in mind that some of our most vulnerable citizens, and we have disabled veterans who reside there, and it's really important that we support Sunnycrest Manor. So thank you all.
Thank you, Dave. Merry Christmas.
Okay, next work session is to to discuss potential action regarding the county procurement policy and purchasing card policy. I think with this, we'll go to Dawn Sherman, Ed Raber, possibly Stella Rundy. So I'll turn it over to you, Dawn.
All right, thank you, Chair. That's a hard work session to follow, so especially with admin policy discussion. But what I have done since the last meeting is there was questions about having the local preference in our policies. So in my updated memo in there, I did put down what the Iowa code has. So that is verbatim what the Iowa code is. And as you can see, it just says that we requires consideration from locally owned businesses, but it does not put any restrictions or parameters around how you apply that. And so what I also did is I reached out to other counties within the state to request their purchasing policies. And I received several of those, and I was able to find some of them online as well. And the ones that I obtained, none of them had any specific guidelines on what that local preference is. They really left it fairly broad as to allow the counties to decide how they would like to apply that. And so in the policy that I have presented, follow back with you, and let me get to that page there for you with the local preference. You can see that on your screen. I left it just very broad. I took out the actual percentages, so it does not limit you on that. And so you as the Board of Supervisors have a little bit more discretion of how you would like to apply that for the purchasing of goods and services. I just want to note that it is not able to be applied to any public improvement. That is separate Iowa code, and it's very specific that needs to go to the lowest responsible bidder. So these are just for the goods and services. So for the procurement policy, this is the language that I'm proposing that gives you some more discretion. In the P card policy, I did add some just general language of encouraging, and I'll get that up there for you, encouraging departments to purchase locally. Let me get that up here. And I think this is more, and again, I left it broad so that, they can apply that in the departments, and elected officials can apply that. But I think it's also even more of a cultural thing than a policy thing, that we're encouraging them to maybe take that extra step and reach out to the local business versus just making a few clicks online. So I put just that we strongly encourage that, because I think that needs to be just as much of a culture than a policy proposal. So those are the only two changes that I made to that, taking into consideration the discussion we had last week. Are there any questions?
Yeah, Dawn, this is Jay. Did you take the language out related to the discount percentages?
Yes, I just added, and pardon me for scrolling through quickly here, just to get that to where it's at. Yes, I added the number 15 on there. And again, the code does not say you have to do percentages. We can put the percentages back in, but this language doesn't confine you to those percentages. It gives you a little bit more flexibility and discretion on how you would like to apply that when you see any bids or quotes that come forward.
I think it actually, Dawn, the first line of local preference has the word must. That takes away discretion in the very first paragraph, very first sentence. It says it must be awarded to the lowest responsible bidder. So I don't know why that line needs to be there, does it? Isn't it contradictory? It must be awarded, but you can do the following things. I don't know.
No, I think that that could be taken out, yes. And then it just leaves it up to that,
Well,
all
I
things
think,
equal, you would.
right, the
get
local
that.
preferences, the Board of Supervisors has a preference to use local businesses. You know, I think that's what I think we're trying to convey, and I don't think that violates the code. You still have to step through all those things, but, you know, interested Supervisor Wickham in your thoughts.
Yeah, no, I don't like that first sentence there. I think it can confuse people as they read that. The other comment I'd have is, you know, by removing the, you know, a percentage discount, so to speak, on bids, does that actually make this weaker?
Yeah, I thought that too.
Yeah, I was looking towards adding or increasing those percentages, not removing the whole language. It is interesting that no other county has a local provision. And I shouldn't say no, the ones we tried to find out, but I mean, I think it's important, and you know, we're generated by property tax dollars, and there are some, you know, some local option sales tax and other stuff that, you know, might add revenue to our coffers outside of people that live in Dubuque County. But I feel strongly about a local preference, and would be probably looking to get that in a percentage or stated somehow, versus it being just the verbiage of it, so to speak. And that document and that percentage will help department heads and people purchasing to know when they, you know, should act on these purchases. The Board of Supervisors doesn't need to get involved in each one of these, and or it's counterproductive if we review these at the end just about either they're going to be purchased or after they're purchased to say, hey, what about local? And so I would look for more, you know, concrete language in here that the board approves that would give direction to those making those purchases to signal to go to local.
Looking at the previous policy here.
Yeah, and the previous policy had percentages, and they were pretty low when you did the whole numbers, the whole dollar amounts. They weren't that significant. But that's where I'm at. I'm not sure where my colleagues are, if you wanted to have the numbers in there, or we'll keep it more general, but I would lean towards a percentage to give people guidance.
This is Supervisor Baker again. This is going to be something going forward. But one of my issues has been the definition of who's considered local. And I just asked my counterparts to consider, you know, that we're going out of state for certain things, and none of this means that somebody from out of state couldn't still be the successful bidder. It just means that somebody who has, you know, set up business in Dubuque County would potentially be given a preference. And I think having it within 20 miles of Dubuque County's borders brings in, you know, 2 additional states. Nothing against our neighbors across the river, but you know, I think our businesses that are in Dubuque County are paying property taxes in Dubuque County.
Can you see my screen where we have what the previous, what the current policy is with the percentages? Are you able to see that on the screen?
Yes.
Yes.
Okay, so just so I understand, is it the percent you're looking at, maybe increasing those percentages to allow, to apply to the local? Are you looking at the straight dollar amounts or just the percentages that apply to those?
Well, both. I mean, I think both. So I would want to have discussion on what should those dollar amount triggers be, and then what percentage allowance you'd have for local. And it's not so much for the board, but it's for those making those purchases. So if you go out, or you're looking at 1 or 2 or 3, quotes, depending upon, the dollar amount, you'll know, and you'll have some guidance on, the allowance. If local is a little more expensive, you have that allowance in here.
You know, the truth is, if people are likely to shop at Amazon, let's just call it what it is. These percentages, I mean, they are who they are because of how they do it. And unless we can install the culture that we as a board have a preference that we use local vendors and that we're giving you the ability to not shop them against Amazon, that's a fail for us when those products are coming that way, if there's a local supplier for any of that. And I don't care that they live in East Dubuque. I'm just as happy to spend my dollars there. So, but you know, that's what we're trying to get to. It's easy to do the clicks, and you can't ever buy anything more expensively on Amazon, as far as I know. So, you know, how do we level the playing field? I mean, we're all talking about the same thing. So, you know, whether that percentage, you know, Jay, when you get right down to it, I mean, you can buy about almost anything at that enterprise is less than a 10% discount, you know?
Does anybody want to propose in there what your percentages or dollar amounts? Do you have thoughts on that?
I think if you add a general comment that the Board of Supervisors has a preference to support local businesses, that's the mission. I'd like to see that be in our procurement policy, whether it's, you know, at the top as a mission statement or as a goal. If you could set that out somewhere, maybe it belongs in the local preference category, but that they know that they're doing what we want them to do generally, just as a preference to look local. In terms of percentages, you can do 10%, you can do 12%, 15%. Amazon can beat you on all of it.
There's a number they can't. So,
Yeah.
you know,
Well,
I think you need guidance. You need guidance to those making those purchases.
what would your
Otherwise,
number
you know,
be?
you might have it the other. I'm working through that. And so I was
Okay.
hoping that's where we were going to start. And so I wasn't prepared to do math on the side. That's
Sure,
what
sure,
I'd like
sure.
to do. I'd be happy to put a grid in there and look at it.
Well, let's move
But
it.
you know, the 10% on $500 is, you know, that's $50. So that's easy. And then you got, you know, it keeps dwindling down and you get 500 to 20,000. So you got two things. You got the percentage, and then you got the milestones of, you know, the dollar amount and when those percentages do, assuming you use the same type of formula.
Okay.
And so maybe I'm asking my colleagues is, do you want that? Is that something you want to have in it? If you just want to have blanky verbiage and I'm the only one who wants numbers, then we can halt with the numbers.
No,
But I think there's
don't-
value in that.
I think there's values in the numbers as well, as long as it all comes with, you know, that's the general, this is the recommendation.
And if you look in there, it does have the word may be given the preference. If you want to make the language stronger, you would require that preference, we would change that to will be given that preference so that it is required when they
Right.
are reviewing the bids and quotes.
And something I would say, just beyond this, if ever we do department head reviews, a question I would insert is the board has a preference for utilizing local businesses. You know, how do you do that? Explain how you do that. So that there's some accountability. They don't need to account for it in a monthly statement, but generally I'd like to know, are people trying to honor that request?
This is Supervisor Baker. I want to point something out. I agree. I think we should, because I can't think where it's been used. You know, unless we just don't get any feedback on that. Do we know
I've tried.
how often the local preference was used, if at all? And I agree that the current setup, I don't like it. I think it's a little clunky. I think it could be simplified, put some numbers out there. But also I'm looking at what's up on the board now. And I think this came into play a few times in discussion. Items 1A and B, it says projects of less than 1,000. So if you don't look any further, if you're talking about a purchase of an item, you probably don't read any further because it's not a project. But it says projects of less than 1,000. Then it goes on to read when the estimated cost of a purchase or project. So you've scared away some people or potentially had them not read any further into that.
Well, Supervisor, this is the current policy. We changed that to divide it out under professional services and goods. So you have the public improvement and then you have goods and services. So that the new proposed language cleans that up. It distinguishes between really a project under the public improvement.
This is the old language.
Correct. Yep.
I got
was
it.
just
Okay.
add this up because this was the percentages that
I thought it came back in here. So okay. All right.
So, maybe diving to the heart of the matter, I would be closer to, a 10% local allowance in that 500, maybe even up to 20,000. And so we'd want to work on some of the math, but I would like to increase those percentages to give a little more local allowance.
Hey, I'm waiting to get on the supervisor meeting. It'll be a little bit.
And there's nothing that, confide you to what's on there right now. You could just do 10% on all purchases. You don't have to put dollar limits on it.
Yeah, I think you need to, my vantage point is I think you need to have some tiers because I'm assuming no one here wants to, at some point you get uncomfortable spending way, way, way too much on something locally. And what those numbers are, I think that's kind of the proof point. And so I think I like having it tiered that when the whole number gets bigger, those percentages also get smaller. That makes sense to me. But I would be okay with somewhere in the neighborhood of 10% up to 20,000 and then possibly, capping that 5% from 20,000 to 50,000. So that's kind of where I'm at. I don't know if there's consensus. We're in the area. I don't know if we're going to solve it today or we need to take another shot at next week or next month.
I generally think it's good discussion and probably we'll get feedback when folks figure, that there are some individuals in our community who just want us to literally use the lowest bid, period. And if it's all purchased online, that's a success in some people's minds. So just by merely holding this issue over, we're likely to get the opportunity for there to be some input.
Do you want the policy to read that with each purchase, a local preference must be applied versus maybe? That's kind of soft language right there.
I would be interested in hearing department heads when you change the language like that of how,
right,
challenging. This is something I don't do, but department heads and other people that do make many purchases for the county, I would want that input before I change the may to shall.
Agreed.
We have a meeting tomorrow. We can run that by them.
And maybe if you run the meeting, if you just run the numbers too. They're taxpayers and most of them live in Iowa, some in Illinois, maybe some in Wisconsin.
Okay, it sounds like we need to go back and get some more input on this. So I don't think we need any action on this. It was on as a work session with potential action. It sounds like there's not going to be any action on it today. So
do you have any, well, we do have the P card policy in there as well.
Okay. We can go to the P card policy next then.
And the only thing that was changed there, let me grab my screen here, was adding the number 10. And if you want, so this is just regarding how employees utilize that credit card. So if you want tougher language here, we would apply it to here as well.
I'd want them to match.
Yeah, I would too, actually.
Okay.
And I
So
do
you're
think,
restating it.
Yep.
right, and this actually, Donna, at some point, I think our new auditor is going to want to look at some of the P card policies. So, you know, if we hold this over, you can have a conversation with Auditor Dragato and ask him, does he want us to hold this, or does he want to revisit it in 18 months or 2.5 years when it, you know, resurfaces? I don't need to put a pile of work before him, but I appreciate you looking at these, and this policy work I think is important.
Okay, well, we will discuss it at department heads meeting tomorrow, and hopefully have something with some additional feedback next Monday.
Yeah, Dawn, this is Supervisor Baker, and just so we understand, I think Megan Bonnert has had significant input into this. I know I've talked with her, so I know Auditor Dolan is also aware of this, and I'm assuming that Auditor-elect Dragato is aware of it. But there are cases where, yes, we're getting a credit for using the P card, but there are cases where we're being charged more or an equal amount for using the P card. And so it's not really that great a deal in some cases. So I think we address that in this new policy, Dawn, if I'm not mistaken.
Yeah, we did, Supervisor Baker. We put on there that the card cannot be used if there's a transaction fee applied to the purchase. So that was one of the new proposals that we made, and that was from feedback from the auditor.
Right. My point was that if we kick this down the road 1.5 years or 2 years, then they're going to continue to get credit for that part of it. If we don't, you know, if there isn't some action taken on this. So maybe I misunderstood the previous discussion, but there are reasons why this has been brought up. So.
I'll add one more language item in there. I noticed that when you talked about maybe the reward or the percent back, it does talk about the Board of Supervisors will have discretion on distributions, but the language was a little clunky. It implies that we will distribute those funds. And I don't know if that's the language we want, but if you want to quick bring that up, I just picked that up. It just implies that we will distribute those funds, which if that's what the board wants to do. But I think what we're trying to do is just add a little more discretion that maybe they aren't distributed to each department. Maybe they go back to the general fund. Maybe they go somewhere else.
We can clean that up. That you'll just have discretion on the
Well,
use
I would ask my colleagues if they agree, or maybe to bring it up. I don't want to have to circle back if we don't like the language. And maybe I'm the only one who is objecting to that language. Can you bring that up, Dawn?
Yep.
You can just solve it.
I would say that if it's going to be distributed, we would have that discretion, but whether or not it's distributed at all, I think that's a discussion for another time.
Where did I find it here? Here we go. You're referencing number 9 of the P card policy.
Yeah. So all P card rebates will be distributed. So that's the language I'm thinking is a little strong. Do we want to do that? So that's implying we will distribute the funds.
Maybe any P card rebate is
Will be
subject to the
managed.
discretion of the Board of Supervisors.
Yeah, that's fine. I'd like that.
Well, make it unanimous. I'm okay with that as well.
And then as to the current likelihood or policy or lack of prohibition about incurring costs to use your P card, I would hope that that's not happening today while this language changes in process, while the policy is being reviewed. Certainly, Dawn, I would think you've directed the department heads that this is an issue that, you know, we're working on, the auditor doesn't favor, and that's ceasing, that they're not incurring charges to use their P card.
Denise, or I'm not sure if Meg is on, if she can, I do not see those if they are occurring. It's the auditor who administers that. But when we did review it with the department heads, we did point that out, that was no longer once we have the policy. So I don't know if it's continuing or not. I don't know if Denise or Megan have any information on that.
Can you not tell them tomorrow that it's over? I mean, do we have to do a policy to make them, department heads, understand that that's not good business?
No, we can tell them to, until the policy is in place, that we're not allowing it. But I don't know if they're able to stop it. I think the auditor's office is only seeing it on the back end. So they're only seeing it after it occurs. So we'll put it in the department head's discussion and also up a follow-up email in case not everybody is there.
Well, let's get this concluded again, then another 30-day project, so that if there's some doubt as to somebody's, you know, how they're interpreting this, I guess we'll get the policy done.
Thank you for the feedback.
Okay. Anything else on the county procurement policy or the P card policy? Sounds like it'll need to come back at a subsequent meeting.
Supervisor Baker,
Yes.
this is Auditor-elect Dragato. How are you today?
Hi, Kevin. I'm fine. Would you like to weigh
Good to hear your voice.
I wanted to just touch base. I pretty much share most of Denise's, if not all of Denise's feelings on the P card and how it's being operated. I wanted to let the board know that this is we all have different priorities, Denise and I. This is a priority for me, sort of looking at it from top to bottom. I like that you're adding, you know, the discretionary idea that the board may choose to pay out these reimbursement, these bonuses, or these that extra cash. But I wanted to assure you guys that this is something that I'm going to be taking a look at early on once I take office. So.
Okay, thank you, Kevin. And I'll just comment that as of a few months ago, this was an issue that was brought to my attention, and I'm not aware at least of anything written that has gone out to department heads or other elected officials who are also department heads, you know, of this change. And so I guess I would like to keep this, I would like for the board to keep this on the front burner, work with Auditor-elect Dragato on this as well.
Yep, he participates in our department head calls, so he will be involved in that discussion tomorrow.
Fantastic. Okay, any other discussion or comments on this? All right. Well, it looks like we're just about right on time here. We have a work session scheduled. Next up is a work session to discuss interim executive director position. And we're right on time. So Dawn, we'll turn that over to you.
So I put together a work session before you see some subsequent possible action items on your agenda. So with the feedback from previous ones, from previous discussions with you, there was discussion about extending on the current interim executive director's tenure to continue to provide some additional resources to this. And so the two additional action items address that. It would be you're approving a personnel action to approve a temporary one through June 30th of 2021. And then after that, you have a resolution, which also includes extending that out to the current incumbent who is performing those duties. And so that will give you as the board time, and I would recommend it be through the normal budget process where we do, that is where we ask for improvements, which would be additional staff members to continue to develop that discussion, determine the need for you and prepare that so that you would have that in your FY22 budget then as well. So this gives you a little bit of time to do that. If you still want to do that, there was discussion of a continued need to have this interim executive director helping out the board and frankly, department heads and other elected officials as well. So this is a time to have that discussion, and then you can either approve or deny the subsequent action items.
One point of clarity, what's the project administrator document? What does that relate to?
So I just put that in there. If you would like to discuss that, that was given some feedback from supervisors and the discussions in your work sessions, just a proposal of some type of job description going, if you would like to consider that, if you consider a permanent position. I think we would continue, I'm proposing we continue on with the current responsibilities of the position, but this would be just a start for discussion of some job responsibilities and duties that I'm receiving feedback on. So there's no action.
Maybe I'm confused on that. Okay, maybe I'm confused on the title, threw me off. Do we have an existing job description or job duties for this current interim position?
Yes. Give me a second here. Share it on my screen here. Let me know when you're able to see that.
I see it.
Okay.
So maybe I'll go ahead and start and share my thoughts and see where that takes us. But first of all, I'd just like to say I appreciate Ed Raber's involvement and his dedication and commitment to this position and the work he's done. So it might be a little awkward when you're talking about one position headed by one person and they're right next to you on the Zoom call. But all good in that capacity. What I would encourage the board to think about and discuss is, one, what were the needs originally for this position? Two, why did we pick the end of the year, December 31st, to have the interim one be limited or restrict change, basically, or stop? And then thirdly, what do we want this position to do if we want this position to move forward? What are our individual needs? Generally speaking, I'm seeing less of the needs, and I'm a little more concerned about the multitasking that's required related to this position. I'd like a lot more clarity related to the position potentially if it moves forward. So that's where I'm at. I thought we had an agreement that it was going to terminate at the end of the year. And, I was actually proposing a different date to begin with, but we ultimately, settled as a board on this date. And now I'm questioning, why are we wanting to change that date?
I'm certainly willing, this is Supervisor Baker, I'm certainly willing to jump in. And as you recall, I was a skeptic about the position to begin with. But when we made the decision, I viewed it as a hire to help us through COVID, the pandemic. And at the time that we did this, I don't think we knew exactly when it was going to end. We might have been perhaps thinking it was, there was a lot of blue sky to think it would be done by the end of the year, but that's the date we chose. And so I think we realize now there's a lot more work to be done on the COVID-19 pandemic. And I think that Mr. Raber's skill set will be very helpful in moving through some of these. I also think he's expanded into some other areas. And I think most of you probably saw the endorsement from Eric Schmeckel and the work that Mr. Raber has been doing in the watershed area. I think there's, perhaps, relations between other governmental entities, large and small, that he can be helpful with his experience. So I think, and what I have said previously, I still agree with that. The next board should decide whether this position is permanent, if that's the right term, or a regular position. But I do support extending this, and this position would expire on December 31st. I think if we're done with the position, if that's what is decided, then there should be some notice. I don't think you wait until December 31st and then on, sometime in January decide if the position is still, to continue on an interim basis. So, like I said, the permanent decision will be discussed and debated during the next budget process for FY22. Extending it would take us through the end of this fiscal year, and that's where I'm landing. And again, when we set that date, I don't think anybody, I don't know if anybody was thinking that that's how long we would need the position, but I think we need it longer than that. I think there's value to the position, and I would support extending it until June 30th of 2021, of course.
My recollection of the discussion throughout has been that we all felt that we needed assistance in the Board of Supervisors department, a department hire to help us do our work. I still feel that that is a need. We chose this date, as I recall, because of the nature of the business that we're in, which is government. And the voters gave us a different supervisor to work with beginning the first of the year. So we don't have a way to transition an interim person into a next Board of Supervisors without this very awkward moment in time where the needs assessment and the usefulness of the job and what it might be. I think we owe it to Supervisor-elect Potoff to have the ability to weigh in on that as well. So, there's lots of things that are layered into the decision to move this forward. I don't want to let go of the fact that it's beneficial to the work that the Board of Supervisors do. There's some things in this pandemic we would not have achieved without Ed Raber's assistance. And so when I look at the position and I look at the candidate, it is two different things for me, as best I can make it be. We have told the voters that we would not hire a permanent position in our department without doing a full take it out and apply and give it to our human resources person to work it up. That requires us to make sure we've got the job description right. And it's impossible to do that right now without Harley Potoff's assistance. And I commend Ed and Harley. I think they've begun to work together and have conversations about transitioning and onboarding and where are we with projects. So that's happening. You know, in industry, this decision, you know, wouldn't happen this way necessarily, but the decider about this is the person actually joining us. One of the key people to vote on the position, making it permanent, hasn't joined us yet. The voters have spoken, but he hasn't actually joined us to cast a vote. So I don't know what our alternative is. The date was chosen because, to his credit, Supervisor Baker, Chair Baker said, hey, you know, I may not be that guy. I may not be here. So I want to know what the outcome is of the election before we decide whether or not that's a reasonable thing to do. It goes back to what you've said several times today, Dave, which is, you know, this has a lasting effect on the Board of Supervisors department, and trying not to weigh in on those lasting effects. So what we come to as a new Board of Supervisors in terms of our own departmental hire, what our need is, everyone's waiting for us to work together and find out what that is. And not everyone is in agreement that we need this position. I think we need a position, not an interim, not a director, but something that moves forward our business at hand in a better way. So I don't know how we cannot move this on to the new year. My preference would have been a date more like April, but I think that aligning it with the end of the fiscal year allows us to do the recruiting and the full determination of what it is. The job description you saw, Jay, was kind of some things that I was talking about at one time or two. We're still, I think, looking for what the job description is. Harley Potoff has told me that he's asked that frequently. What's this guy do? And so, you know, getting that before people to say, this is what this position will help us achieve. It's you know, Ed's sitting there in an awkward position on not knowing whether or not his contract's going to be renewed, extended. So, you know, I'm of the mind that we need to continue this into the new year and hope that Harley Potoff gets his answers as well.
So, Ann, I'm not sure if maybe I didn't make myself clear. I was not trying to make a permanent decision, but rather extend the interim.
Correct.
And then that would give Supervisor-elect Potoff an opportunity to, you know, make an assessment.
I understand, and I mean, anyone can count the votes. I see that we can take this forward, but you know, I never want to lose our colleague, and what Supervisor Wickham brings to us in the richness of his governmental and his business experience is essential. So, you know, what would be the motivation, or why terminate it now? You know, I'm interested in hearing that. Otherwise, let's pick a date and agree that our work's done. I don't think that Dawn Sherman thinks we have a final job description. She's working on various things, and
Well, I think, my experience with government is many times what they do is they postpone decisions. So they, at the highest level, the federal government hasn't had a budget forever. They continue to do continuing resolutions because they can't agree. And, we made a conscious decision based on the information we had to terminate this position, the interim part at least, at the end of the year. And what we're talking about, or at least it seems like there's some sort of discussion, is continuing that on to basically give yourself more time, kick the can down the road. Somebody else can make the decision. And my experience is that's we have enough body of work, and we've been doing this for how many months? Was it 9 months? You've got 9 months of experience related to Board of Supervisors and this position. You'd think the board would be able to say yes or no. And what I'm saying at this point would be probably no. And I don't want another interim position. I don't see that serving the people. I don't see that serving the board. And you still can add another position. Boards can add positions. We added a new janitor just a couple months ago. And so the board has the discretion at any time to add additional people and staff, including this position. And what I'm saying is right now, it just seems like there's a lot of unknowns and a lot of good work being done, but you're working on COVID testing, and then you're working on water quality issues, and then working with local governments. And so there just seems to be a lot of, there's not as much direction and prioritization related to this position that I would want. And so that leads me to say, let's do a redo if the future board wants to consider it. And so that's where I'm at this right now, is letting the contract expire and taking it up in the new year if the board wants to do that. I think the other piece that I would like, since this position works with the board, is for it to be unanimous, both current and future boards. But that's more of a preference. I know that's not how we govern, but having somebody work very closely with Board of Supervisors and not being unanimous, and one not wanting the position, makes it a little more challenging. But that's just more of a preference than an actual method of government.
If, and not, certainly not making light of this, Supervisor Wickham, but if we had to depend on unanimous decisions on every issue, we probably wouldn't have got a hell of a lot done over the last several years. So
agreed. It's a preference. Yeah. So, I mean,
yeah,
I'm fine. I realize that. So it's just a preference. The other comment I have is thought about is if this is pandemic specific. So if we are in unusual times, unprecedented times, everybody said that we've had, 100 and almost nearly 140 people die and thousands become infected with disease. It's really both socially, economically, and health-wise been very painful. And we're all trying to learn it, and we need more hands and more minds to lessen the load. And we heard that from the Board of Health today. So another caveat I would be interested in, if you're interested in my support or this idea, is having this position report right to the Board of Health and have it being dedicated to pandemic relief and pandemic issues. That type of interim tag I could believe. And I think that's kind of the flavor we had early on. And then we shifted into other priorities that were, needs as well. And, Ed Raver's done a tremendous job in each one of those. But I don't like the variedness of the position, and the priorities may shift. I don't think the board's been clear on what those priorities are, and that's kind of on us. But one way to modify that is to have this position be dedicated to the Board of Health and the director of the Board of Health and work only on COVID issues. I could support that for another 6 months, assuming the Board of Health would also agree that's a good idea.
Well, one of the largest projects that Ed Raver worked on in his position was a $600,000 FEMA grant that we received. It hasn't been formally announced and press released because we are waiting for some final documents to come. And with transition at the federal level, we'll see. But that would never have happened had we not had a person who could bring that up to speed and work that up in that time constraint. So this job was never intended or never actually worked fully committed to a COVID response. That was a big piece of it. But a lot of this is, as you say, on us. What reporting back did we ask for? What we, you know, shoulda, woulda, coulda, looking back about things we might have put in place when we first looked at this position. But we don't have a good flavor of what kind of reporting back we're going to get. Specific projects, I don't have a problem identifying specific areas that we would want a person to work on behalf of our department. But that's where we are right now. And those are things we can work on as a new board to hold each other accountable and to hold the new position accountable. So I do favor carrying it over. I never saw it completely as COVID related. And to the comment that there would have been more decisions made that were unanimous, there really is a purpose to build consensus and not just count votes. So, your input into how we can do this and how we might move forward, I don't think that the work we need to be done is completed by any means.
Okay.
Where are we with, what do you need from me? Is it a motion? This is just supposed to be general discussion.
Yep, coming up, you have a requisition that would extend approving this position through the end of the fiscal year. And then after that, you have a resolution for appointment, which would include extending that to Ed for that duration as a temporary full-time basis. So you have two action items coming up on the agenda.
Supervisor Wickham, are you interested in having Dawn give any higher perspective she has as our HR administrator, who's, also impacted because she sits in our department, as to what she thinks there is, if there's a recommendation that it be continued?
I actually asked for departmental or peer reviews as well. So yes, I'm very interested in those other department head elected officials and feedback. And I think we did receive one from Eric Schmeckel, I think Supervisor Baker mentions, but I think it's really more of a board of supervisors and priorities that I'm really focused on. I think I've made my point pretty clear that I think the involvement that has had a positive effect. But I think there's there's a lot of things we could do differently that we're not. And I think hearing the conversations, reminds me that we're not quite ready for this position. And we're talking about priorities, where should it be, and maybe the Board of Health, and you got the pandemic. My experience is in private sector, that's not you want the right people on the right bus in the right seat, driving the right location. And I don't think that direction has been given by the board. And so continuing on doesn't make a lot of sense to me. I would rather get it right, understand the priorities, have the new board realize that, and then go get the right talent we need to do that position. And it may be 100% COVID related, or it may be a flavor of items, but just continuing with interim just doesn't feel right.
Well, I think we've had the discussion during the work session. I think we'll probably need to move to the next item, which is the approved personnel requisitions. Now there's two. So the first one, and we're on item I on the agenda, which is approve personnel requisition. The first one is a permanent full-time assistant county attorney from the county attorney's office. And Dawn, we'll go to you, and then CJ if he's available.
Yeah, CJ received notice of an upcoming retirement at the end of this month. So this is replacing that upcoming vacancy. So it is a budgeted position. So we're recommending approval for this.
And the position is budgeted, correct?
That is correct.
Okay.
I'll make a motion to approve the personnel requisition for the Assistant County Attorney.
Second.
Motion was made and seconded to approve the personnel requisition for the Assistant County Attorney in the County Attorney's Office. Is there any discussion on the motion? All in favor signify by saying aye.
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 Aye. And it's carried 3-0. Okay, next up is item I2, temporary full-time interim executive director, administration. This is the position that we've been discussing for the last half hour or so. And, you know, again, I fully understand and respect Supervisor Wickham's position, but I would like to see the, you know, if permanent's the right term or making it a regular position, I would like to see that done by the next board. But I just think we need to act on whether or not this position is going to remain, because I don't think it's fair to have it end on December 31st and then have a period of wondering if the position is going to be there. I don't think that's doing anybody justice, including the county.
I'm going to make a motion to approve the personnel requisition for the interim executive director on a temporary basis as presented.
Okay. Is there a second? I will second that. We're open for discussion. We have a motion and a second. We're open for discussion.
I have no further discussion.
Okay. And anything additional?
No.
And I don't have anything either. All in favor of the motion signify by saying aye.
Aye.
Aye. All opposed use the sign of nay.
Nay.
It's carried 2-1. Thank you. Okay, next up is a resolution approving appointment of deputies, assistants, and clerks.
You see this on the screen there. This is approving the hire of a part-time Sunnycrest worker in their kitchen facilities. And then also then with that requisition that you just approved, extending the offer to Ed Raber for the duration of that.
Question, is there any value? It's one resolution, so I'll make the motion to approve the resolution.
There's a motion to approve the resolution. Is there a second? I will second it. We're open for discussion. I'll just point out we have a Sunnycrest Manor permanent part-time food service worker position, and we have the position under administration, temporary full-time executive director, also known as interim. And Dawn, is that the temporary full-time is the same as interim? Is that correct?
Yes, yep. It's
Okay.
in the requisition, you only approved it through June 30th of 2021.
Correct. Okay. All right. Any other discussion or comment? All in favor of the motion signify by saying aye.
Aye.
Aye. All opposed use the sign of nay.
Nay.
Okay. Ayes have it. It's carried 2-1. Okay. Next up is item K. It's appointments under the Watershed Working Group. I am assuming that we'll have Eric Schmeckel involved in this discussion. I think Ed Raber has been involved in this. And let's see. Who wants to bring us up to speed on the Dawn? I guess I'll go to you first.
Eric Schmeckel asked that we put these on. This is a new board and commission, and so Eric has more background to it. He's just asked that we put it on now because they are preparing to start some meetings soon.
Yeah, hey, good afternoon, supervisors. Received 2 applications to be part of, or I should say to be appointed from the Dubuque County Board of Supervisors to come up with our total of 6 in the Watershed Working Group. If you recall, we've got 2 Soil and Water District, 2 from the city of Dubuque, 2 appointed, or 2 from the Dubuque County. And then the last 3 would be remaining rural farmers or rural landowners to make up a 9-member board. These are 1-year terms. I had 2 females apply that are very interested in being part of it. Lily Behringer is one of them, and Marissa Waldo is the other. They both filled out the applications that you have hopefully are included in the packet. Marissa and her husband Andrew both graduated from UW-Platteville with a soil science degree. They are starting a small farm just outside of Cascade. They are really engaged with folks in that area and are excited about being part of this board. Both Marissa and Lily, they know each other. They both have completely different farming operations, but I think that they will bring a really good perspective and have that millennial farmer, kind of feel to this group, which I think is important. That we have some, A, that we have females on this board, but B, that we have hopefully some younger farmers in this group as included. Marissa and Andrew are almost under contract. We're in the final phase of getting that contract worked out. They're going to be entering into a 32-month contract with City of Dubuque and the NRCS to help with our farmer engagement and outreach. So I've been talking to Marissa and Andrew quite a bit the last few months. The work that they'll be doing under that contract, it is separate than what Zach Tim is doing, but Marissa, Andrew, and Zach will all be working together in a lot of different ways, not directly, but we'll be communicating weekly as farmer engagement and meetings are taking place. So we had a one gentleman that was working on an NRCS grant. Like I said, there's 32 months left of this grant. It didn't work out with him, so Marissa and Andrew are going to be hopping out. But Marissa was really excited to be part of this group, as well as Lily. Lily's 24. She just bought she's been farming with her parents and her grandparents her whole life, and she just bought her own piece of ground, her own farm in Dubuque County. She's a cattle farmer, so she'll be, I think, another big perspective. Both Marissa and Lily farm differently. So again, I think it's a good mixture of representation from Dubuque County.
Eric, Dave Baker, I'm really happy that we got 2 really good applications. The only question I have is it appears that they're next door neighbors. It's a beautiful area down there. I believe it's real close to the Miller farm where I was given the pleasure of speaking to the Farmer Field Day group. So the only thing I was thinking was the soils and the topography are different in the southern part of the county than they are the northern part of the county. Now, the fact that there's room for 3 more kind of takes away that question for me, because I wasn't really understanding. I didn't know that we had officially, because we had talked about whether a supervisor or multiple supervisors might want to be on this board. I would support these, but I just wanted to point out that it looks like they're neighbors on the opposite side of the road. Just wanted to, I guess I just wanted to get that out there, and they're from the, being their neighbors, they're from the same part of the county, and we have a wide variety of soils and topography throughout Dubuque County. That was my point.
Yeah, that's definitely a good point. Fair statement. And like you said, I do think we'll have, the last 3 positions to be appointed from this group of 6. I have a handful of farmer names that have been given to me that would like to be included as far as having the last 3 appointed. Jeff Schmidt will represent, he's a soil and water commissioner. Jeff farms on the north end of Dubuque up towards Balltown, Holy Cross area. So I think that'll be good. Tim Daly has expressed interest to me multiple times that he would be hopeful that he could serve. Tim is farming just outside of Bankston area. So I think, we'll have to look at the remaining 3 to make sure we can kind of geographically place farmers. And Jeff Pape has mentioned to me he'd like to be involved. I know Jeff's out, kind of in the Dyersville area. So, and again, these are 1-year appointments. Just excited to kind of get this board meeting and discussing, really sharing input. As we all know, these are brand new programs in Dubuque County. We're all excited about them and supportive, but this whole thing needs to drive and work with the farmers included. Not for us to be telling them, here's our brand new programs, come sign up. We want to be, engaging in them and getting feedback the whole time throughout the course of the year, as it relates to not only operational changes on farms, but also structural projects throughout Dubuque County. So, but yeah, that's a good point. I know that they're kind of close in that same area. So we'll definitely take that into consideration when the last 3 that get appointed.
Okay, thank you, Eric. Supervisors McDonough or Wickham, any comments, questions?
I do have one question. What Marissa Waldo's contract with Dubuque County? Tell me more about that, Eric. And I think originally we didn't want staff, or we didn't want paid professionals on this. What's that contract? And I also see not official yet. So do you know much about that scenario?
Yeah, that's maybe that's me talking to Marissa and confusing her, because she filled this out probably 30 or 40 days ago, I bet now. I don't know if there's a date. Yeah, 11/19. So about a month ago. The work on this, Marissa and Andrew potentially were going to work with Dubuque County under the conservation and grounds position, but it ended up through discussion decided to engage into a contract alone, set a loan from Dubuque County by itself with NRCS, and that is actually through the Catfish Creek Watershed Board. So that's actually, we just had a meeting last week. They approved the contract for Marissa. We're just waiting on final approval from the city of Dubuque. That doesn't have anything to do with the county. So it's Marissa being a little confused when she filled out the application. And partially was me talking about the new conservation and grounds position with her. It probably confused her.
Okay, thank you. That helps clarify it.
Okay, Eric, I have a question. These applications, are you looking for us to take action on these? Are you anticipating more applications coming in? Would you like action sooner than later? Before you answer that, I'm prepared to move forward with these with the discussion we've had. But if you want to tap the brakes, I'd want to know that.
No, I'm looking for action to move forward and get these meetings underway. And again, you know, as soon as we have our first meeting, it would be great to have all 3 supervisors be part of it. Obviously, the first meetings are going to be Zoom, so they aren't going to be we're not going to, you know, there's a lot of kind of disadvantages to the Zoom meetings and getting a feel for a brand new board and everything. But as we engage throughout the year, hopefully we can, you know, start meeting in person as it gets warmer out and so forth. But yeah, today I'm looking for action to appoint Marissa and Lily on behalf of Dubuque County. And understanding and knowing that if any supervisors would like to be involved in these meetings, they're open to the public, and I'll certainly let you know when we're having meetings, and if we need to get them posted, I'll work with Dawn on that.
Okay, any other comments or questions for Eric Schmeckel?
And these would be, Eric, so these would be our 2 seats, is that right?
That's correct, yep.
That way appointments, okay.
Okay, is there any other discussion? Otherwise, a motion would be in order, I guess, one way or the other. If I'm not hearing from my counterparts, I'll make a motion to approve the 2 applications in front of us.
Second.
Motion and a second, open for discussion. I think I said what I needed to say. Anybody else? Okay, motion was made and seconded. All in favor of the motion signify by saying aye.
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 Carried 3-0. Okay. It's unanimous. All right, next up, we have a resolution approving the contract between Dubuque County and Truterra LLC. And we have Eric Schmeckel and Ed Raber ready to tee it up here. So
this is Ed Raber, and if that's okay, Eric, I'll start just briefly here. If you remember back in my memo, I highlight this. A couple of months ago, the board approved by resolution some spending priorities for some different programs for a fund that was created for this fiscal year that I've just started to call the Land Stewardship Fund, the Dubuque County Land Stewardship Fund. One of those was for an initiative that Eric Schmeckel brought to the board, Truterra LLC. It's part of the Land O'Lakes Co-op. And the presentation that they gave is reflected in this sample contract, or this draft contract that we're preparing for you here today. It highlights the work that they do and the contracts that they would be working with us to prepare for the Board of Supervisors with individual farmers for the services that Truterra would be working on. The incentive for farmers will be based on some actionable things that they do to improve their Truterra Insight score, which is based on some computer modeling that they have that's proprietary about the impact water quality, reducing runoff, storing carbon, things like that. The agreement with Truterra also spells out that there's a fee, 7.5% fee that they have to actually run and engage that with individual participants, local participants in Dubuque County that they'd be doing that with. So the contract, if you looked at the contract, I'm sure you all looked at the contract, but it spells out that we would be paying them an amount not to exceed 7.5% of $100,000 The remainders of that doesn't go to Truterra. It goes, it will be allocated on a contracts with individual farmers around Dubuque County that want to participate in this initiative. The contract, Eric and I worked directly with Truterra on developing that. It looks very similar to the contract that you approved last week. A few different changes. This particular one, there's a section on intellectual property. They continue to want to guard that. We're not licensing that intellectual property. They're just trying to highlight that they're using it, but it does not become ours. We have had discussions that if this turns out to be the success that we think it's going to be, that we may want to look at actually licensing that in the future, but any recommendation or discussion of that will be after we've kind of got into it. Does anyone have any questions about either my memo, the contract, or the resolution?
Do you have any questions for Ed Raber? Ed, I really appreciate the memo that you put together. Very informative and helpful. Thank you. Supervisors McDonough or Wickham, any comments, questions? I think we're all aware of this. And are we ready to take action? There is a resolution.
Ed, Ann, with the question. This is the form that you've begun to use for the purchase of services. I think this is the same model that we've used.
Yes.
Right. Have you discussed that format with CJ just to make sure?
I have. He seems to have, we did not originate, we did not create this. We borrowed this from another area service provider. And he has not indicated that he has any, found any legal exposure or anything in last week's contract or this one.
Make a motion to approve the resolution.
And I will second that.
Motion made and seconded to approve the resolution. Open for discussion. Hearing none. All in favor signify by saying aye.
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 Aye. Carried 3-0. It is approved.
Thank you.
Thank you, Ed, for your work, and Eric as well.
Thank you.
Okay. Public comments. At this time, anyone may address the board on matters which are of concern to that person, which are not agenda items. Please go to the podium, state your name and home address. Also, you can go on Zoom. If you're on Zoom, we'll unmute you. You can contact us through chat or raise your hand. And please be aware the board is limited in their ability to respond to such inquiries, and Iowa Code prohibits the board from deliberating or acting on items not appearing on the agenda. If you do speak, please give your name and home address, and I will impose a 3-minute limit.
Chair Baker, this is Dawn. My staff has emailed me that Leo Simon is asked to speak in the public comments, and he is on and unmuted. So Mr. Simon is on.
Okay, Mr. Simon, you can speak under public comments.
Leo Simon, 840 South Grandview. I spoke, Dave, a little bit with you, but the supervisors ain't aware of a long-going issue. For one thing, I can't take it out in the county attorney now, but back in 2002, we sued the county over a road deal. So you ever hear that payback? So the county, I had $88,000 worth of fraud, and the county attorney didn't do nothing because of that. And so now I got an issue with the sheriff's department that they won't do nothing with it. So I want to know where to go with it. Is the sheriff's department bond and insurance, is that separate from the county? And then another thing that I had a long-going deal is a county employee working for the county, and a retired county attorney told me, I don't know Leo, but I know an issue. when they had Steve Thurn working for the county and Deesa Nolan's leaving now, and I didn't want to, I have several reasons why I didn't do nothing about it yet, but that's a big issue. We need to have Denise give the new guy that's taken over all the information, because that was handling big dollars and the county just swept it under the rug. So I am going to do something with it. If the sheriffs ain't going to do their job and the county attorney, which I don't know how we're going to handle it. It's just like one of you supervisors working a whole year for nothing and not get paid. If you just want to do that, that's fine. But I don't think I should take this loss of people writing out checks and no county attorney doing that. So I do want some, issues of what we can do here.
Okay, anything else, Mr. Simon? You understand we're not allowed to engage in discussion under this public comment, so.
Yeah, no, I understand. I want to know where to go with it and stuff like that there. And how do I get back? Will I get something in the mail, or what? How do I do this, or what?
As chairman, I will ask for staff, the appropriate staff, to reach out to you, and I would ask them to contact you and start a dialogue.
I appreciate that. And
you and I, just for the record, you and I have spoken a few times on the phone. With your permission, I'll share your phone number and let have the appropriate staff contact you, because it needs to be handled by staff.
Yeah, and it needs to be handled professionally. We got a new bunch of people. I think these are all good people, but they let the wheels get too loose. Okay.
All right. Thank you, Mr. Simon.
Thank you. So good luck, Dave. You bet. Bye. Bye.
Okay. Is there anyone else that would like to speak in public comment?
Chair Baker, I don't have any notifications of any further speakers today.
Well, being I'm the chair, I'm going to take a little discretion. I've already been contacted by a citizen about hard servicing Christoph Road. I thought I'd share that with my counterparts. I will be sharing that with Anthony, but I thought doesn't exactly fit our public comments here, but I guess I'll report that as a citizen, so make it legitimate. But so people do listen to our discussions. So, all right, anybody else for public comment? All right, if not, I believe our next meeting is next Monday at 10 a.m. So I would ask for a motion to recess until next Monday at 10 a.m.
I have a question for the chair. There is nothing on that agenda in civic clerk for the meeting next week, except the, not to make light of it, but it's the update from the folks who were here today saying they don't want to report as much information to us. So, it's the day after the holiday weekend. So I would hope that if we're meeting, maybe we're meeting just about that issue. I don't know if there's any county business that we need to attend to for what that's worth. That agenda needs to be worked up by Wednesday. We're closed Thursday and Friday, of course.
Right. I don't know what's going to land on the agenda. I don't expect a heavy agenda, if that's, I think that's your point. I guess I would like to talk to Dawn and or Ed to see, what needs to be on the agenda, what's out there. So, anyway, the motion to recess would still be appreciated and in order.
So moved.
And I will second that.
Motion made and seconded to recess, and that is non-debatable. So all in favor signify by saying aye.
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 Aye. And everybody have a great holiday, and we'll look forward to you seeing you and talking to you on Monday. Show us in recess at 3:11 p.m.
Merry Christmas.
Thank you, and God bless all
Merry
of you.
Christmas all.
Happy holidays, everybody.
Thank you, Harley.